It's time to be smart. When we control our institutions, we win. This is the most important news show on television of any racial background. Y'all put $2, $3, $4, $5, $10, $15, $20, $30 on this and keep this going. What you've done, Roland, since this crisis came out in full bloom. Anybody watching this, tell your friends. Go back and look at the last 2 weeks, especially of Roland Martin Unfiltered. I mean, hell, go back and look at the last 2 days. You've had sitting United States senators today, Klobuchar and Harris. Whatever you have you can bring to Roland Martin Unfiltered to support it, please do, because this information may literally save your life.
Watch Roland Martin Unfiltered daily at 6 p.m. Eastern on YouTube, Facebook, or Periscope, or go to RolandMartinUnfiltered.com. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com. You want to support Roland Martin Unfiltered? Be sure to join our Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible. Is that you have a lot of journalists who are saying flat out, don't carry his news conference live because of the lies. An NPR station in Seattle, they announced that they're not going to carry his news conference live, saying they don't have the capability to fact check what he's saying because too many lies are being told from the podium.
I mean, I think it's a good idea. I mean, one of the president's main responsibilities is actually being able to share correct and accurate information with the country, to share what the steps are, where we are in this respective pandemic. And when you have someone who has a very hard time with the truth, it doesn't do anything to help us to move forward. It actually puts us behind the 8 ball, and it makes people wonder if they can trust anyone in the government.
I mean, right now, turn this up. Y'all listen to this. Turn this up.
This incredible, we were having the most successful years that we've ever had in the history of our country. You saw what happened yesterday with the stocks, and today they're up. I'm telling you, if Steve gets the deal done, the incredible incentive deal is going to take care of people. It's going to take care of our workers. It's going to take care of companies that employ all these workers. Small and
turn
big.
it down.
By the way,
so here's what's amazing. Here's what's amazing. Go turn that down. Turn it down. Turn it down. So here's what's amazing as you listen to that nonsense. He's talking about how he hears from all. I want to hear a little bit of it. How he's hearing from all these businesses who say they want to get back to work. Everybody wants to get back to work, but nobody wants to die.
So, Vice President's going to stay with you?
Nobody wants to die. If you have a restaurant that's packed,
we'll see you tomorrow. Thank you very much.
You're not trying to die. Pence is going to continue. Fine, we can bail out of it. But you don't want to die. You're talking about, again, putting people together. We are seeing an increase of the people dying. We're seeing that. And he's also lying. He put out a tweet earlier talking about how we've done more tests than anybody else. Well, if you say we've done more overall tests than any other country, yes, but if you actually did it based upon the size of a nation, we have not. Again, this is the sort of the line that he plays. And again, we're at this point, Mustafa, we still don't know how significant this thing is. I'm going to pull up comedian Kathy Griffin. Comedian Kathy Griffin, y'all. I saw this before I came on the air. Kathy Griffin tweeted out this is what she did. This is in response. So Trump tweeted out, just reported that the United States has done far more testing, go to my iPad, than any other nation by far. In fact, over an 8-day span, the United States now does more testing than what South Korea, which has been a very successful tester, does over an 8-week span. Great job. Okay, first of all, here's Kathy Griffin. He's lying. I was sent to the COVID-19 isolation ward room in a major hospital ER from a separate urgent care facility after showing unbearably painful symptoms. The hospital couldn't test me for coronavirus because of CDC Pence task force restrictions. Hashtag test, test, test. And this is a photo of her from the hospital bed. And so Trump is out here. Let's get back to like everything was. The economy was great. We were just the best in the world, the best ever. But if you're a store owner, do you want 100 people walking through the door?
Right.
And you don't know whether or not you got coronavirus?
Yeah.
If you work in a movie theater, do you actually want 350 people sitting right next to each other watching a movie, and then somebody coughs or somebody sneezes, and all of a sudden the entire movie theater goes nuts because you don't know if somebody's sick? That's why the health people are saying you have to maintain this shelter in place. Mm-hmm. And some are saying it needs to be national because we don't have a handle yet on how significant this is. And the experts, Mustafa, are saying it's not going to be until April until we think that we've reached sort of the apex to know what we're actually dealing with.
The president, throughout his administration, has continued to place profit over people's lives. We can go through all the various aspects that a presidency has to deal with, everything from environmental issues to housing issues, down the line. But, I'm not sure where the president is getting his information from, because I actually have talked to a number of the leading public health leaders in the country. And many of them, you remember, there was supposed to be a database. And in this database, folks were supposed to filter in the information where the various testing was happening. So there's testing that's happening, at the hospitals, and then other private entities are doing testing. And he also likes to take credit for other people's work. So Governor Cuomo, who has been leading in New York State, has been, guiding the process. And he's actually been forcing and pushing to make sure the testing is happening, looking for the equipment that's necessary for the medical personnel to be able to do their job, in an efficient way. And before that, you had Jay Inslee in Washington State.
Well, again, it is, just for people to understand, go to a split screen. Again, Pence is talking. And the whole point, why I'm going back and forth, because, look, y'all need to hear what they're saying. Go to it. I want to hear what Pence has to say.
The president and I were in direct contact with governors of New York, California, Washington State, New Jersey, Michigan, and others. And we continue to be inspired and impressed by the leadership that governors are providing in their states, making tough choices, leading their states.
So he's talking about how inspired and impressed they are.
Grateful.
Yeah, the Daily Beast has a story where it shows that Donald Trump is pissed off because Andrew Cuomo has been critical of him. And Donald Trump's way of doing business is, if you're not nice to us, then we're not going to do business with you. Exactly the same thing happened with Puerto Rico. All right, folks, back to our Roland Martin Unfiltered video in just one moment. All right, so a lot of y'all are always asking me about some of the pocket squares that I wear. Now, Robert don't have one on. Nope. Now, I don't particularly like the white pocket squares. I don't like even the silk ones. And so I was reading GQ magazine a number of years ago, and I saw this guy who had this pocket square here, and it looks like a flower. This is called a shibori pocket square. This is how the Japanese manipulate the fabric to create this sort of flower effect. So I'm going to take it out and then place it in my hand so you see what it looks like. And I said, man, this is pretty cool. And so I tracked down, it took me a year to find a company that did it. And so they make these about 47 different colors. And so I love them because, again, as men, we don't have many accessories to wear, so we don't have many options. And so this is really a pretty cool pocket square. Now, what I love about this here is you saw when it's in the pocket, it gives you that flower effect like that. But if I wanted to also, unlike because if I flip it and turn it over, it actually gives me a different type of texture. And so therefore it gives me a different look. So there you go. So if you actually want to get one of these shibori pocket squares, we have them in 47 different colors. All you got to do is go to RolandSMartin.com/pocket squares. All right, so first of all, that graphic is way too small. So tomorrow we're going to run it right down here all across the screen. So it's RolandSMartin.com/pocket squares. All you got to do is go to my website and you can actually get this. Now, for those of you who are members of our Bring the Funk fan club, there's a discount for you to get our pocket squares. That's why you also got to be a part of our Bring the Funk fan club. And so that's what we want you to do. And so it's pretty cool. So if you want to jazz your look up, you can do that. In addition, y'all see me with some of the feather pocket squares. My sister, who's a designer, she actually makes these. They're all custom made. So when you also go to the website, you can also order one of the customized feather pocket squares right there at rolandsmartin.com/pocket squares. So please do so. And of course, that goes to support the show. And again, if you're a Bring the Funk fan club member, you get a discount. This is why you should join the fan club. Now back to your Roland Martin Unfiltered video. You want to check out Roland Martin Unfiltered? YouTube.com/Roland S. Martin. And subscribe to our YouTube channel. There's only one daily digital show out here that keeps it black and keep it real. It's Roland Martin Unfiltered. See that name right there? Roland Martin Unfiltered. Like, share, and subscribe to our YouTube channel. That's youtube.com/Roland S. Martin. And don't forget to turn on your notifications so when we go live, you'll know it. You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real. It's Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to rolandmartinunfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. rolandmartinunfiltered.com. Well, y'all, the drama continues when it comes to the White House and, Jesus, these corona briefings. They simply cannot get out of the way and focus on the issue at hand. Folks, as of today, 605,000 plus cases of coronavirus. 25,394 people have died. 10,000 of those people in New York City alone. 38,000 patients are recovering from the virus. Folks, this has been just a stunning chain of events in this country over the last 2 months. In his daily briefing, the governor of New York, Andrew Cuomo, says they are flattening the curve. He explains.
Total hospitalizations actually basically flat, technically tick down, which is probably the first tick down. So that's a good sign, but basically flat. So we think we are at the apex, on the plateau. The number of hospitalizations went up, flattened, continuing to flatten, good sign. Technically, the number's down a tad, statistically irrelevant, but better than being up. The net change in total hospitalizations, if you look at the curve, which is what, when you do the 3-day average, which is more accurate than any 1 day, because remember, this reporting mechanism is new. We put it in during this situation, so I wouldn't bet all the chips on any 1 day. But when you look at 3 days, you look at the overall curve, we think it's indicative. So the 3-day average is down. The net change in ICU admissions is down. Again, the ICU admissions I take with a grain of salt, since hospitals are no longer what they were, and they're basically all ICU wards.
Folks, today's White House briefing has not started yet. We'll see exactly how crazy it is, because yesterday was truly, let's just for lack of a better phrase, batshit crazy, where Donald Trump actually blamed the media for his failure to lead.
People should be more concerned right now with the flu in this country.
A lot of people are concerned about the coronavirus because they're hearing a lot of news about it right now. But the reality is, comparing it to the flu, for example, it's not even close to being at that stage.
What if it is worse? Is this a moment where maybe countries put politics aside, a little bit of pride aside, and do we have U.S. officials, should U.S. professionals such as yourself get involved?
How worried should Americans be?
Okay, see, that's that propaganda video Donald Trump actually showed yesterday. And when he got questioned, he literally said, I'm the king. I can do whatever it is I want to do.
tens of thousands, maybe hundreds of thousands of lives by
time that you bought. The argument is that you bought yourself some time and you didn't use it to prepare hospitals. You didn't use it to ramp up testing. Right now,
you're so disgraceful. It's so disgraceful the way you said it. Let me just listen. I just went over it.
To make people
I just went over
in
it.
an unprecedented crisis.
Nobody thought we should do it, and when I did it.
But what did you do with the time that you bought?
You know
the
we
month
did.
Of February. That
we did.
Was a gap.
What do you do?
Month of February.
What do you do when you have no case in the whole United States?
You had cases
when
you
excuse me, you reported it. 0 cases, 0 deaths on January 17th.
February, the entire
January.
Month of
I said in January.
Your video has a complete gap.
On January 30th.
What did your administration do in February with the time that your travel ban bought
A lot. A lot. And in fact, we'll give you a list. What we did, in fact, part of it was up there. We did a lot. Look. You know you're a fake. You know that. Your whole network, the way you cover it, is fake. And most of you, and not all of you, but the people are wise to you. That's why you have a lower approval rating than you've ever had before, times probably 3. And when you ask me that question, let me ask you this: why did Biden apologize? Why did he write a letter of apology? No, that's very important. Why did the Democrats think that I acted too quickly? You know why? Because they really thought that I acted too quickly. We have done a great job. Now, I could have kept it open. And I could have done what some countries are doing. They're getting beat up pretty badly. I could have kept it open. I thought of keeping it open because nobody's ever heard of closing down a country, let alone the United States of America. But if I would have done that, we would have had hundreds of thousands of people that would right now be dead. We've done this right, and we really have done this right. The problem is the press doesn't cover it the way it should be. Go ahead, one more.
Oh, so he's upset the press just doesn't kiss his butt and do what he wants to do. Well, today, he had a photo op with folks who've survived the coronavirus. Let's just say he is not happy with Paula Reed of CBS. This happened today. Go to my iPad.
Thank you all very much. We'll see you in a little while. Thank you. Thank you very much.
Let's go, Paula.
Are you concerned? You travel
Paula,
pretty
we're
far.
done.
It's
Let's
a
go.
risk.
Paula,
Do any of you have reason to leave
We're
your
finished.
vacation?
Paula, let's go. We're done.
Thank you, sir.
Please. Thank you. Keep going. Let's move.
Thank you. Thank you all very much. We'll see you in a little while.
Let me just say right now, if y'all not following Paula Reed of CBS on Twitter, you should. That's how you are to stand up to an idiot. That's how you are to deal with somebody who is completely out of control, who does not want to answer any questions, and who wants to berate and demean the press at every juncture. Joining us right now is Congresswoman Bonnie Watson Coleman of New Jersey. Congresswoman, glad to have you on the show.
Thanks for having me.
To look at that complete meltdown. He doesn't like being challenged. He does not like being challenged by a woman. He has treated women in the White House press corps worse than anyone else, and that's simply what he cannot tolerate. And this guy actually thinks that he can do whatever he wants as if no rules, no laws apply to him.
So, Roland, the President of the United States has a multiplicity of problems. He's a pathological liar. He's not very smart. He doesn't understand government. He has no compassion. He has no morality, and he has no values for anything other than what he thinks makes him look good. And to tell you the truth, as a person who's been in government the majority of her life, and a person who, even as an African American in a country that didn't always treat us and doesn't always treat us the way we should be treated, I love this country, and it hurts me to my heart that he uses that bully platform to berate people, to denigrate the office, to lie outright to people, and to spend that time when he should be giving us information as to what makes us safer, giving us information. How are you going to get the doggone supplies to the people and the hospitals that need them? How are you going to make sure that the money that's been in these bills to protect people who are not getting a paycheck? How are you going to support the small businesses that are dying now because everyone is staying home? How are you going to protect the people on the front lines in the hospitals? Where are you going to get them the supplies that they need? Instead, he stands up there like a raving maniac and idiot. And it's sickening to watch.
Of course, he's on the news. He's on right now, beginning this news conference from the Rose Garden. I don't carry his news conferences live when he is speaking, primarily because he lies too much. And so, to me, I would much prefer to go back and fact check what he said to ensure that what he gave out was proper and correct. If Dr. Fauci or Dr. Burke steps to the microphone, or any of the health experts step to the microphone, we will do that. But the reality is, anytime he speaks, and even Mike Pence, when he comes up to basically back up whatever he just lied about. So that's one of the reasons why we do not take what he has to say live. We now are also, go ahead, I'm sorry.
We thank God for the fact checkers.
Oh, yeah, absolutely. And so, and again,
Absolutely.
So it's not a question of saying, well, no, we can't play what you say, but you better be truthful when you actually speak. Yep. Let's talk about what is happening when it comes to additional assistance. I am hearing, I've been talking about this for the last several weeks, but it's really the case now. I'm hearing from more and more African-American business owners who are scared to death that they're going to lose their business. They're going to have to lay off and fire staff. They're going to lose everything that they have. And so, you know, what is Congress doing to ensure that more dollars are going to go to these businesses and not also be a logjam where these banks are picking winners and losers and they're leaving out many black folks?
Well, right now there's a negotiation that's taking place that involves Democrats who want to make sure that money and resources get down to the smaller businesses, the minority businesses, women-owned businesses, disadvantaged businesses, even the nonprofits that work in those communities. So Mitch McConnell had proposed another tranche of money, billions of dollars, hundreds of billions of dollars, to go out to small businesses because they are using the money up really quickly. But the problem is that they put them in categories where they were competing with people with 500 employees, very sophisticated businesses, and the smaller businesses weren't getting the kind of traction that they needed or the attention. And those that didn't have certain banking relationships weren't even getting the attention of the banks. So we're negotiating as best we can to make sure that a portion of the money that gets out in this interim bill, and this is not the big bill or the next big bill or the next big bill that may have to come out, but this interim bill that's being negotiated right now, in addition to having money go out to small businesses, that there are carve-outs for the very small businesses, for the small banks, the community banks, the minority lending institutions that Republicans have refused to target and support. And at the same time, we're trying to negotiate that the money gets into things like additional SNAP provisions, additional direct assistance to individuals who need those checks, as well as making sure we have appropriate PPE and other kinds of gear that hospitals need. Our hospitals are desperately needing money. And so we're negotiating that right now as an interim bill. And it's a tough negotiation because we know that the small businesses need additional money. It was gobbled up really quickly. We know that the smallest of businesses, the ones in our communities, didn't get enough attention. Our churches aren't even getting the attention that they need, but they're supposed to be support and protection for even them. So the negotiations that are taking place right now are pretty painful, I think, but we're not going to give in until we get some guaranteed support that gets down to the neediest, not the greediest.
Let's also talk about a bill that CDC members are also pushing, and that is to compel the federal government to release daily race data when it comes to coronavirus. Why is that important?
Well, because we're finding out, and just really no surprise to any of us, that when America gets a cold, black folks get pneumonia, that the disproportionate impact on the black community in both the infection as well as the death rate is something that we need to pay attention to because that's what happens to us. And so finally, there's a discussion on the main stage. Even Dr. Fauci mention it, recognizing that we've got this disproportionate negative impact happening in our communities. So we need to have data collected on a daily basis, because from that data, we need to know where to send the resources and to send them in a expedited way. We need more testing. We need rapid response testing, and we need it in the communities that have been underserved as well as in other communities. So that's why the data collection is vital.
Also, last question for you. You early on caught the directive from the Department of Labor suspending affirmative action guidelines. Is that still in place? You raised the issue, the National Urban League and others picked up on that. And so where do we stand when it comes to that?
Well, we sent a letter to them. The Black Caucus has been pushing that out as well. We've asked that language in any bill that comes out under the coronavirus support mechanism has language in it that says that you will not dispense any of the affirmative action and EEO requirements in any government activities under the coronavirus bill. So I haven't gotten a response from them. I don't expect them to go easily on this, but I think it is an important issue that we need to focus on, because affirmative action has only been about leveling the playing field. And so with these hundreds and hundreds of billions of dollars, trillions of dollars that are going to go out as a result of this coronavirus issue, we need to be able to benefit from it from the service perspective as well as the business perspective.
All right, Congresswoman Bonnie Watson Coleman of New Jersey, we certainly appreciate it. Thank you so very much, and we'll keep giving them hell. Thank you so very much. I want you to like, share, and subscribe to our YouTube channel, youtube.com/Roland S. Martin, and don't forget to turn on your notifications. You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. Roland Martin Unfiltered. Yesterday's press briefing, Donald Trump revealed that he thinks he's a king. Check this out.
Your understanding of your authority vis-a-vis governors. Just to be very specific. For instance, if a governor issued a stay-at-home order.
When you say my authority, the president's authority, not mine, because it's not me. This is when somebody's the president of the United States, the authority is total. And that's the way it's got to be.
Your authority is total.
It's total. And the governors know that.
So if
the governors know that. Now you have a couple of bands of excuse me. You have a couple.
Could you rescind that order?
You have a couple of bands of Democrat governors, but they will agree to it. They will agree to it. But the authority of the president of the United States having to do with the subject we're talking about is total.
That is utterly laughable. Joining us right now is Patricia Broussard. She is the constitutional law professor at Florida A&M University. All right, I'm sorry. Excuse me for laughing, but Patricia, really, you don't even forget reading the Constitution. You can at least, just walk by it and know that's just stupid.
Well, under normal circumstances, I would agree with you 100%. Probably last month, I would agree with you 100%. So, there are two different questions you're asking. You're asking, is it constitutional? That's one question. You're asking, can he do it? That's an entirely different question that you're asking. And first, let me thank you for having me on. And secondly, let me shout out the Florida A&M University College of Law, my colleagues, and especially my students who I love dearly, and to my alma mater, Howard University School of Law. So, in
Doc, you getting all the shout-outs in.
Well,
you leave anybody out? You want to do your high school, your middle school, your elementary school?
Well, this is such a hard time for everybody. The students are suffering really a lot, so I have to prop them up a little bit.
I got you.
But to the first question, when I saw that clip, I was like, what is he talking about? So if you have to guess what he's talking about, if you have to speculate as to what he's talking about, he's probably not talking about anything that makes any real sense. I couldn't figure out if he was talking about powers that he derived from the Constitution, inherent powers of the presidency, emergency powers, or what exactly he was talking about. But I concluded that irrespective of if he was talking about constitutional powers, inherent powers, or emergency powers, that he would still be wrong with respect to whether those are constitutional. So that's my first answer, that, you know, we can go through an academic analysis of all of those powers and we can see that it's not in the Constitution that says he can do that. It's not an inherent power because the court has said in Youngstown's Sheet and Tubing Company that there is no inherent powers to the presidency, and that has been debated since the Constitution was drafted. Alexander Hamilton said there were inherent powers. James Madison said there were not inherent powers to the president. And by inherent powers, we mean powers that are not listed in the Constitution but are derived from the position of being president. For example, you know, if you're the president of a fraternity, you get to bang the gavel. So it doesn't say that in the rules, but it says that inherently because of what you get to do. So no inherent powers. The emergency powers are circumscribed and limited. And so I have no idea what he's talking about. Now, when he said something about I have many, many, many powers, that's what led me to believe that he was talking about the Emergency Powers Act, because there are actually 136 actions that can be taken as a result of that act. But it's circumscribed. It's not unlimited. But the thing about it is there's this little thing that we have called the 10th Amendment. Mm-hmm. And the 10th Amendment says that all the powers that are not explicit, all the powers that are not delineated in the Constitution go to the states. So I find it ironic that you would say on the one hand, states, you're on your own, get your own respirators, ventilators, masks, you can do this, and then to turn around and say, we're going to dictate the parameters of how you handle this emergency that we have stepped back from. So I think the 10th Amendment is very clear here that the governors can make decisions, they can do what they want to do. The problem I have and my hesitancy, and the reason I said, if you had asked me this last year or previous to this, I would have said, oh, unquestionably, he can't do this. The problem that I have and the wild card that I have is the United States Supreme Court. I'm not sure, you know, when you see a Supreme Court rule that in the middle of a pandemic, you can have an election, no problem. When you see a United States Supreme Court that says, oh, it's okay to have a travel ban, when you see a United States Supreme Court that seems to, and I can only speculate, that at least 4 or 5 members at least bow down to the president. So I think he's feeling pretty confident that the court will back him. But in addition to that, what are we going to do? Because when I read that Constitution, it says we the people. And so I think the power is in our hands to say, we're not standing for this. But like I said, the question is, is it constitutional? I'll say no. If the second question is, will he do it? Can he do something? I wouldn't put it past him.
Well, right, because here's a guy who, remember, when he came in, he's like, oh, I'm told I can do whatever I want, that no laws apply to me, that that his whole deal is I can't be charged, you can't do anything. He has uttered many times before, I can do whatever I want. And he actually believes that. But here's what's interesting. So clearly there was a conversation, probably with some Republican governors, as Republicans in Congress. And so this is Donald Trump a few moments ago on that whole issue. Watch this cleanup on aisle 7.
The plans to reopen the country are close to being finalized, and we will soon be sharing details and new guidelines with everybody. I will be speaking to all 50 governors very shortly, and I will then be authorizing each individual governor of each individual state to implement a reopening and a very powerful reopening plan of their state at a time and in a manner as most appropriate.
Doc, I love this. I'm authorizing governors.
Yes.
To reopen their states when you can't authorize jack for a governor?
Yeah, under what authority are you trying to do that?
But see, that's the cleanup. That's the cleanup. The cleanup is I screwed up yesterday. I know the hell I was talking about. Now I'm authorizing each governor. I'm authorizing individual governors of individual states on a powerful plan to reopen their state when you can't tell them what the hell to do.
You're not the boss of me, not with respect to that. And like I said, the irony behind saying you're on your own, get your own ventilators, get your own masks.
Right.
And if you try to get them, we're going to intercede in some way and prevent that. And then to turn around and say, but I get to decide the parameters of your plan. I think that's intellectually dishonest, and that's not going to happen, period.
Patricia Broussard, constitutional law professor at Florida A&M. We certainly appreciate it. Thanks a lot.
Thank you so much. Good night.
And I want you to like, share, and subscribe to our YouTube channel, youtube.com/Roland S. Martin. And don't forget to turn on your notifications. Like New Orleans, in Louisiana. If you go to my iPad, Henry, this is the front page of NOLA.com. Louisiana coronavirus cases increased by 30%. Deaths up 29%. See numbers for Orleans and Jefferson. If y'all can let me know when a coordinator is there, I would certainly appreciate it. I told you what is happening in Albany, Georgia, becoming one of the top cities for the coronavirus outbreak. The numbers are climbing fast as results trickle in. We're seeing their system there being overwhelmed as well. It is just stunning to see what is happening. And one of the problems that you have here, of course, is that what you have is again, just the failure of the federal government to act in a timely manner. In Georgia, they've had 3,817 cases, 108 deaths. In Fulton County, 547 cases and 17 deaths. That's where Atlanta is. Albany, where some 75,000 residents, 71% of them African American. That county is Dougherty County. 455 cases, 18 deaths. DeKalb County, 325 cases, 3 deaths. Cobb County, 272 cases, 11 deaths. Gwinnett County, 233 cases, 2 deaths. Let's go to Albany, Georgia coroner Michael Fowler, who joins us right now. Sir, glad to have you on Roland Martin Unfiltered. It is stunning to see what is happening across the country. Give us a sense of what is happening in Albany, Georgia.
It is. We definitely have lost quite a few of our friends and family, ones that we know in the community. And it is devastating here to see this virus take so many out.
When you talk about that, I was reading a story the other day, I believe it was in the Atlanta Journal-Constitution. They talked about there was a funeral that took place there. Someone who wasn't from there came there, attended the funeral, and then a number of people had been infected as a result. Again, when you think about how this, we kept trying to explain to people, even 2 weeks ago, don't get together in gatherings. And unfortunately, people did not heed that advice.
That is true. So many still are trying to get together now and meet. But like I said, we need to practice social distancing because the issue came, like you said earlier, someone came to a funeral, and then one funeral went to another funeral, and then the virus spread like wildfire. So it have devastating our city here.
Henry, go to my iPad. This is the story in the New York Times. Days after a funeral in a Georgia town, coronavirus hit like a bomb and it swept through the community there. Coroner Fowler, the thing that, again, folks, you put the graphic back up there, the fact that you're the coroner for a city, 75,000 residents. You're not the size of Atlanta, yet you look at the fact that Dougherty County is not even close to the size of Fulton County, but you've had more deaths and little less than 100 fewer cases. That says that rural areas in America are going to be greatly impacted. They're not getting the attention that they deserve.
That is so true. And the figure that they have on the count now is 30. We have 30 deaths, and this unheard of in a small city that you said is Albany, and it's instead of rising every day, we getting calls. One funeral home had so many cases at the funeral home they was talking about getting a refrigerator truck. That's how devastating it is here.
What precautions are you having to take? I read some stories where some funeral homes are moving towards cremation, not wanting their workers to touch bodies. What precautions have you taken?
Well, I've encouraged it. I'm a mortician too, so I've encouraged the funeral homes and the embalmers also to use universal precautions. If you do that, you'll be safe and clean up and sanitize once you get finished. The goggles, the mask, the respirator, the booties. Then once you finish embalming, just destroy those clothes and take them off and destroy them. But a lot of the funeral homes are still embalming, and also some are cremating, but they can be embalmed.
It's amazing that your advice is to destroy that gear, that PPE, after they've done that. And then you've got Donald Trump talking about why can't we spray something on masks and reuse them?
Well, like I said, I would want to take that chance. The same thing when we had TB, other kind of viruses. We always believe in destroying those things. We have many embalmers and funeral directors here. We're saying the same thing. We don't want to carry anything home to our kids or to our grandkids. Why take a chance? We don't want to be the first one to carry it home. So it's cheaper just to destroy the item and get something new, put something else on it.
Your city is 71% African Americans. What are you saying to also preachers? Are people still trying to gather for church? Are they still trying to gather in groups? And what are others saying to get folks to understand that you can't chance this thing? We played the case earlier. There's one guy 3 weeks ago. He said his parents were in perfect health. They died today.
Well, many of the cases that we've seen here, I mean, they have underlying medical condition, but a lot of them are young people that have died too. So the social gathering, I think they are doing a whole lot better now. They understand it's real now because you can see some of the friends or the co-workers that you know just have died. So their eyes are coming open now. So a lot of the churches now complying to what the orders are now.
And you said you've had 30 in the city or 30 in the county?
30. I'm Daughter County corner for the whole county. 30 in the county.
Wow. That is again unbelievable. There, it is just amazing to see what is happening. You mentioned that you're seeing young folks. Of those 30, how many of those folks have been young? Let's say under the age of 40 years old.
Well, our average is 42 to 89, and the average is 60. But we do have some 40s, and we have had a 30-some-year-old gentleman pass too. So that's our average from 42 to 89.
Wow. Well, it is certainly sad. Certainly our prayers go to the families there in Albany, Georgia. Many people may not remember that's where, of course, Dr. King and others went there for the Albany movement during the 1950s and 60s and the Civil Rights Movement. We certainly appreciate you, Coroner Michael Fowler, joining with us and giving us an understanding of what's happening there. Actually, the last question, I was reading one story where we talked about how the hospitals in Albany have been overwhelmed. Are you getting assistance from the state? Are you getting assistance from the federal government?
Well, they have been coming in now, more prevalent now. They are coming in to assist a little bit better now. In the hospital, I mean, they're just so overwhelmed. I know the people are tired. They have done a great job, but I know they're tired because of the hours that we all are working. And now getting calls all times of the night. But the hospital quarters are full of people, and they're shipping them out to other hospitals now. And quite a few of them are black, Afro-American. And 90% of the ones that have died is Afro-American. And so it's a serious virus here in our community that we got to do what we got to do to help counteract this thing. Wow. Well, we certainly appreciate you joining us, sir. Thanks a lot. Thank you.
Man, I want you to like, share, and subscribe to our YouTube channel, youtube.com/Roland S. Martin. And don't forget to turn on your notifications. You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible. We're talking about how people handle these things. Italy continues to have new cases of COVID-19, and a group of mayors are furious because people will not stay at home, and they have been, let's just say, quite vocal in letting them know.
Mi arrivano notizie che qualcuno vorrebbe preparare la festa di laurea. Mandiamo i carabinieri, ma li mandiamo con i lanciafiamme.
Che domani vi becco, domani, non pensiate tra anni, domani. Sono il sindaco, sul mio territorio non si passeggia. Non vi posso impedire formalmente di uscire da casa? Bene, vi impedisco di passare sul suolo pubblico.
Allora mi rivolgo a voi, ma dove cazzo andate? Dove andate con questi cani che hanno la prostata infiammata?
E voi, non è previsto il ping pong, non potete giocare a ping pong, andiamo alla PlayStation. Siccome io sono il sindaco di questa città, in questa città il decreto lo faccio rispettare io. Quindi se ne deve andare a casa adesso, non voglio le scuse. Tutti, dovete stare tutti a casa, devi andare. Non si può stare in mezzo alla strada, come ve lo devo spiegare? Non si può stare. A casa. La mazza, le fidanzate con la mazza ci vogliono.
Te cazzo di parrucchiere che vanno in casa a aggiustare i capelli e febbre, a che cazzo servono? Cioè, ma l'avete capito che
No, I'm going to have a conversation with the panel and to buy some time.
Ho incontrato un nostro concittadino che amabilmente faceva la corsetta su e giù per la strada accompagnato da un cane visibilmente stremato. L'ho fermato e gli ho detto: guarda che questo non è un film, tu non sei Will Smith in Io sono leggenda, quindi passa pa casa.
You are not Will Smith in I Am Legend. Mayor Mario King, I know you had to be laughing to see the responses from those mayors in Italy fed up with dumb residents who won't keep their ass at home.
Look, I'm going to tell you, we've seen so much here. We've seen people on the beach have bocce parties. We've seen people just not listening. We've seen people congregate at parks. We've seen them. Well, but this is the deal, though. You know, Roland, think about this. Me as a mayor, I put in a mandate to stop these things. And then here goes the governor that comes right back out and say, hey, reopen the beaches, reopen the restaurants, reopen this, reopen that. You can do what you want. Just, it's a strong urge. He said, this is what his words was, his exact words. He said, this is no longer a recommendation. It is a strong urge to follow the CDC requirements. People need more than going to the website. They keep saying they want to put the faith in the people. If we keep putting our faith in the people, we're going to keep seeing the numbers rise. Everybody is not going to adhere to what they're telling them. And I just think that it's very sad, and I just think it's bad. When you talk about patient 31 from South Korea who was in the church, I closed down all the churches here because some people still wanted to have churches. Some people didn't understand it. Some people didn't agree with it. But I said we need to close down the churches. Now you see all this. You see things happening like patient 31. You see these. I'm telling you, it's the same thing I could tell you. I've been telling you the whole time. You see every single environment that they've opened up are environments that are known places to spread this disease. So to open them up is a complete disregard and a complete irresponsibility of leadership. But it's mayors that took a stand in the state of Mississippi who was completely, I'm talking about it's preemption at its best and an irresponsible action of the governor at his worst for him to be able to put that executive order in that clearly that says that all of our orders are null and void at this point. So we have no option or no ability at this point in time to even act in the state of Mississippi if our measures are more extreme than the governor's measures based on his executive order.
And
foolishness.
And Brittany, I thought Republicans always loved local control.
They absolutely do. It's scary. Even listening to Mike Pence say yesterday, he literally said in the conference, he said, we are using a strategy that is locally executed, state mandated, and federally supported. And you've had several experts come out and say, this needs to be an all hands on deck federal mandate. We all have to be on the same page at the same time to slow this down. And, you know, it's falling on deaf ears. And like was said earlier, as long as we continue to see the differences happening in states, in different local municipalities, we're not going to get this thing under control. And quite frankly, I absolutely love that video of all of the Italian leadership. I know they're cursing. I know they're using funny examples, but they give a damn. And you should give a damn when people's lives are at stake.
It's just, Mustafa, what's interesting is you see what people are doing out here. There was a question that was asked at the news conference today of Dr. Fauci. Is it helpful for people to be sewing masks for health workers and others to wear? My mom is one of the people, she's sitting here, sewing masks. He said, you would only recommend that under desperate situations. I don't see that now as a necessity. All right, folks, back to our Roland Martin Unfiltered video in just one moment. All right, so a lot of y'all are always asking me about some of the pocket squares that I wear. Now, Robert don't have one on. Nope. Now, I don't particularly like the white pocket squares. I don't like even the silk ones. And so I was reading GQ magazine a number of years ago, and I saw this guy who had this pocket square here, and it looks like a flower. This is called a shibori pocket square. This is how the Japanese manipulate the fabric to create this sort of flower effect. So I'm going to take it out and then place it in my hand so you see what it looks like. And I said, man, this is pretty cool. And so I tracked down, it took me a year to find a company that did it. And so they make these about 47 different colors. And so I love them because, again, as men, we don't have many accessories to wear, so we don't have many options. And so this is really a pretty cool pocket square. Now, what I love about this here is you saw when it's in the pocket, it gives you that flower effect like that. But if I wanted to also, because if I flip it and turn it over, it actually gives me a different type of texture. And so therefore it gives me a different look. So there you go. So if you actually want to get one of these shibori pocket squares, we have them in 47 different colors. All you got to do is go to rolandmartin.com/pocket squares. All right, so first of all, that graphic is way too small. So tomorrow we're going to run it right down here all across the screen. So it's rolandmartin.com/pocket squares. All you got to do is go to my website and you can actually get this. Now, for those of you who are members of our Bring the Funk fan club, there's a discount for you to get our pocket squares. That's why you also got to be a part of our Bring the Funk fan club. And so that's what we want you to do. And so it's pretty cool. So if you want to jazz your look up, you can do that. In addition, y'all see me with some of the feather pocket squares. My sister, who's a designer, she actually makes these. They're all custom made. So when you also go to the website, you can also order one of the customized feather pocket squares right there at rolandmartin.com/pocket squares. So please do so. And of course, that goes to support the show. And again, if you're a Bring the Funk fan club member, you get a discount. This is why you should join the fan club. Now back to your Roland Martin Unfiltered video. You want to check out Roland Martin Unfiltered? YouTube.com/Roland S. Martin. And subscribe to our YouTube channel. There's only one daily digital show out here that keeps it black and keep it real. It's Roland Martin Unfiltered. See that name right there? Roland Martin Unfiltered. Like, share, and subscribe to our YouTube channel. That's youtube.com/Roland S. Martin. And don't forget to turn on your notifications so when we go live, you'll know it. Folks, a little bit earlier today, I had a chance to talk to former Surgeon General Dr. Regina Benjamin about coronavirus, about what should be happening. We want to thank the people at YouTube for facilitating this. Here's my conversation with her. Dr. Benjamin, glad to have you in Roland Martin Unfiltered.
Thanks for having me, Roland.
Let's get
Good
right
to talk to you again.
Indeed. Let's get right to it. The news of the day, Donald Trump has told the governors that it's up to them how they reopen their state. Duh, they already had those powers. But they're targeting May 1st. As someone who served as Surgeon General, you are a doctor, you've got your clinic there in Alabama. Is it wise for people to try to rush to reopen businesses and try to go back to business as usual when we still don't really have a firm grip on coronavirus in the United States?
Well, Roland, I kind of look at this whole thing. I have this analogy of hurricanes because I went through Hurricane Katrina, and people understand hurricanes. You follow the track. This hurricane got into the Gulf of Mexico. It was Category 4, now it's Category 5. It was starting to hit land. I think it's made landfall, and it's starting to move by. And everybody knows that when you have a hurricane, the hurricane has an eye, and you don't go out in the storm, in the eye of the storm. You may have good weather, you may even have sunshine, but you know you're in the eye of the storm, and the next phase is going to come through. So we wait until the storm passes by. Once the storm is over, you go out and you assess the damage. This virus, we have to assess the damage to see how much damage was done once that storm is over.
But are we
and the way
actually
we
assessing?
do that, but the way we do that is we do that by seeing how much immunity is in the community, how many people have had it, and how much natural immunity. We need tests to do that. So we need to be testing, and we need to be building those tests, which we're trying to come up with so that we can see and have something to base it on to know whether or not we're safe to go out or not.
Well, and that to me, I keep going back to is still the craziest thing here. He's touting, we've done more tests than any other country. But if you look at it per capita, we have not. The fact that we represent 30% of all coronavirus cases in the world, and we're still having hotspots in South Dakota. You have the governor there who doesn't want to issue a shelter in place, but they're seeing more and more cases every single day. We're seeing how coronavirus is rampaging through nursing homes across this country. And when you keep asking the question, even Dr. Anthony Fauci makes the point that we have not reached critical mass when it comes to testing.
Roland, we can sit and we can argue the points about what should be done, shouldn't have been done, but I would like to try to save lives. And the way we save lives is that we need to take care of ourselves. What can we in our communities do to take care of ourselves? We have to start to do things. We're seeing that the number of cases, we've been talking about health disparities for the last 20 years. And so it's been known. What we didn't know was that people with these underlying conditions were going to get sicker. They're going to get sicker faster, and they were going to die more. And so we need to concentrate on what can we do to be resilient. What can we do right now to take care of our families and each other?
Well, and what is bothering me the most, again, look, I totally understand when we talk about the economic impact of coronavirus. Forget the stock market. I'm just talking about out there, just everyday people. Best Buy laying off furloughing 51,000 people. Numerous companies, small businesses, mid-size, large. When you talk about...
Roland, if you think about that, and those are very tough things, and these are tough times, and what I hope that we can learn from all of this as a society, as we come out on the other end of this, is that it is tough, economic tough. It's hard when you don't know where your next paycheck is coming from. It's very difficult when you don't know how you're going to put food on the table. And if you do have a job and your kids are not in school now, what are you going to do for daycare? Those are very real things that we're dealing with. But you know what? Poor people have been dealing with this all along.
Right.
And I hope that people will have more empathy and understand what these single moms are going through every day and the challenges they have, the stresses they have in their lives. And we'll stop blaming the victims, and we will start putting in more public policies and things on the other end that will be much better for our society than what we've done in the past.
Well, the point that I've also been stating, that death is real. There's a video, Dr. Oz was on Fox News, and he was talking about the potential possibility of, reopening schools, and he makes this comment about, a 2 to 3% mortality rate. And then you hear people say, well, we lose X amount of people when it comes to the flu, so, we haven't lost that many people here. We're still talking about death. The other thing is that the problem...
It depends on whether it's your death or my death, how important it is. But yes, it is real.
Right. I literally was just watching this this clip of Laura Ingraham saying, some people are fine with catching the virus. And I'm sitting here going, and I literally tweeted back, I said, well, you let me know the people at Fox News and Fox Business are cool with catching the virus. And the thing is that we still don't even know how this thing is moving and acting and responding. And so I've had numerous scientists and medical professionals on here. And
it's just like a hurricane. We don't know what it's going to do. We don't know how it's going to change. We have to be prepared for whichever way it changes. It's new. And you're right. We don't know how they're going to change, and we have to change with it. And the more information, the more data we get, the more we can put in our predictions can be much better. It's just like that hurricane tracker. When they go and fly into that storm, they get better data, and we know better once we get that. We're collecting data, we're constantly changing it, and as we get more information, we can make our plans and adjustments more reliably than just guessing.
Well, to that point right there, when you talk about the data piece, and I think that's critically important, you have the people now who are critical. Oh, the initial model said we were going to lose 100,000 or 240,000 people. Well, first of all, the initial model was also based upon if we didn't do mitigation. And so... also those models is just like a hurricane model. The initial model, when it's way out there in the Atlantic somewhere, is totally different when it gets into the Gulf and you've got more data to make your model on. It's much more precise. Yeah, so it changes. I'm from Houston, and so I can tell you, okay, the hurricane is projected to veer towards New Orleans, and then all of a sudden, oh, it's coming to Houston. That's right. Because you got more information now. And what you based it on 2 weeks before was not the same. So that's what we're constantly going through these changes. The other thing is as I said, we don't go outside in the eye of the storm. We know the weather is good. We know it may even be sunshine, but you don't go out during the eye of a storm. You wait until it passes by. Yeah, and once it passes actually the eye ain't the problem. The tail is the problem. It's worse. And I think using that comparison, I think when we're talking about what's happening right here with coronavirus, if there is this rush to reopen, now all of a sudden, so just a perfect example. So where I do my show here, we do it with the Office of 50 CAN, Education Reform Group. And I sit on the board of directors. And so we're still here, okay? I've got two people who work in this office, but they're working separately. Then I'll have, when we do the show, max 5 in the control room, really about 4 people, okay? I'm out here alone. My panelists are via Skype. So the people at 50 CAN, they're not here. But if all of a sudden you bring 8 to 10 people back, some other offices, 20, 30, 50, 100, all of a sudden you don't have the same containment that you had when you had shelter in place. And yes, I get the economic loss and people being furloughed and not working, but the flip side is, which I got to think about, what happens if somebody contracts it? Now, what happens to them economically in their family? Hospital stay, things along those lines. And so all the people... What happens when people die? Yes. Because we're seeing deaths and they are dying. And so that's the main concern. And nobody wants to be the cause of death. And as knowing someone or having a loved one to die when it was preventable. Absolutely. What would you advise in terms of messaging that should be specifically for African Americans? When the White House last week when they came out and they talked about, like, all of a sudden they were surprised by this disproportionate number of African Americans dying. And then Dr. Anthony Fauci stood up there and said that they didn't realize that asthma was an underlying condition. I had a doctor from Meharry on who was like, any black medical person could have told you that. So we've been talking about health disparities again for about 20 years. We even have a National Institute of Minority Health and Health Disparities at NIH that's doing that research because we know that these disparities exist. And what I have been saying and want to emphasize even more now is that when we first started talking about the coronavirus, we were talking about elderly and people with underlying health conditions. What people didn't realize, they thought, cancer, they thought HIV, some of those type conditions, but what they didn't think about was diabetes and high blood pressure, strokes, cardiovascular disease, somebody with a cardiac arrhythmia who may be working and doing very fine all day but have an arrhythmia. I'm on the board of the American Heart Association, and we're putting $2.6 million into research around cardiovascular disease and health disparities. And so these things are there. We knew that these underlying conditions are more prevalent in our community. What we didn't know was that the coronavirus was going to be affecting us much faster, much more, and more people were going to die from it.
And that's where the big questions come in, is that how do we prevent people from getting it? And the first thing we can do is socially distance ourselves. And most of us are, but some are not. And so if I were going to give you any advice, the first thing is to wash your hands, wash your hands, wash your hands. And then the social distancing really does protect you and your loved ones, and just stay as 6 feet apart from each other. Just don't spread it. Don't give it to someone else when you may not even know you had it yourself. And then you don't want to contract it. We have to protect each other.
Well, on that particular point there, what I keep saying, I literally told the White House this. I said, look, you need to have black folks, black and brown people out there as well talking about this, because the reality is African Americans, look, when it comes to who do we trust more? Do we trust an African American doctor? Do we trust a white doctor? Same thing in media. Where am I getting my information from? And I said, guys, look, I said Birx is fine, Fauci is fine, but to your point, you have a whole apparatus at NIH. You need to have, versus Trump running his mouth in these news conferences, put the experts up there to share the information so people can actually learn about what's going on with this.
And we have an opportunity here through you and others like you to give the good basic information to people, and hopefully they'll listen to you and look at you and watch your leadership and follow your leadership in doing these things. And we'll see, I'll see on social media where some group has had a party and they're talking about how great a time they're having. I heard it put best by a guy from New Orleans who had overcome the virus. He'd come off the ventilator. He says, you guys, you can either be socially distanced or you can be socially dead. Your choice. It's just that simple.
Right. It is just that simple. Final question for you, and we talk about models and things along those lines. I've been saying to friends of mine, I've been saying to folks who work for me, look, I don't think for a second this goes away in 3 months. To me, I said we should be preparing ourselves mentally that this is going to be from now until the end of the year. When you look at what is happening in New Orleans, where the mayor said, look, no major events for 2020. The folks at Essence really wanted to have Essence Festival. She wouldn't budge. They announced they cancel it. We'll be back in 2021. I just think that this thing is so uncertain. I think it makes sense to prepare yourself for the long haul. And then if it's shortened, great. But just to your point.
Roland, we got common sense.
Yeah.
Use the common sense.
Well, everybody ain't got common sense.
Yeah, but more of us have it than don't, I hope.
Right. Well, again, that's just sort of what I'm sort of, and using your point about the hurricane. Hey, even when that hurricane is gone, you might have flooding, you may have other things that actually happen. You just have to prepare yourself for that because it's there. And I just think this is something we've never seen before, never experienced before. Prepare yourself mentally for it.
After Katrina, we had never seen anything that big. We are still overcoming Katrina to this day.
Wow, that's a decade later.
It takes years to overcome. So to think that we'd be ready to be completely back to normal in 2 weeks is not common sense.
Absolutely. Dr. Regina Benjamin, we certainly appreciate it. Thanks a bunch. If folks want to get more information on your public policy institute, where can they get information from?
Basically, it's Gulf States Health Policy Center .org or BayouClinic.org.
Well, we certainly appreciate that, and hopefully those governors in those Gulf states are paying attention to what you and others are saying there, as opposed to some of the decisions that we're...
Actually, I've been working with our governor to put together an information hub. I'm working with a tech company called Yext, and they've done a wonderful job of pulling all the information together so that people can go and get good, solid health information. Everything that the health department has, the statistics is on a dashboard at that site. We call it COVID-19.alabama.gov. And basically, you can go there and get it yourself. Look for it yourself. You don't have to listen to anybody else give you their opinions of the statistics. They're there. There's also places to find jobs. In Alabama, we have 11,000 jobs that are available. You can apply online. We also have how to track your illness. If you think you're sick, where you can get your test sites. All of that's there so that people can take control of their own destiny, their own health by having information, because information is power.
All right. Dr. Benjamin, we appreciate it. Thanks a lot.
Thank you.
All right, I certainly want to thank Dr. Benjamin for that. And just so you understand why we don't take these news conferences live, we just missed Dr. Fauci. We'll try to pull his clips up. Go to my iPad. Sam Stein just tweeted this. He's with the Daily Beast. He said, Trump just now touting 3.5 million tests completed is a weird boast because on March 4th, Mike Pence pledged 4 million tests by the end of that week. In fact, if you see the bottom of this, the White House promised 27 million coronavirus tests by the end of March, but just hit 1 million. So here we are in the middle of April, and they're saying, hey, 3.5 million tests, when y'all said we're going to have 4 at the end of 1 week. You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible. Folks, the Federal Bureau of Investigation is warning that in the middle of the COVID-19 pandemic, neo-Nazis and white supremacist groups are urging members to infect law enforcement and Jewish people with the disease. Members of white extremist organizations discuss specific ways to do that, such as spraying cops using bottles full of bodily fluids or sending infected members to crowded public areas, especially those with large numbers of Jewish people, according to a report by ABC News. Quadricos, look, the Trump administration has focused so much on Muslims as opposed to these white domestic terrorists. We've been saying it from the beginning. Don't ignore these crazy white folks.
You're absolutely right. I mean, you have COVID-19, this unseen enemy to deal with. And now, unfortunately, being Jewish, being black, being person of color in this country, you have to continuously worry about white supremacists. What the administration should be focused on and what he should instruct the DOJ to do is to halt these groups. Unfortunately, do we think that he would? Absolutely not, because they very well might take this as a credible threat. And that's why I think we have to empower ourselves as well as ensure that our communities are taking care of each other and ourselves. We can't necessarily always depend on law enforcement. We cannot necessarily always depend on the administration, but we can depend upon our communities. We can go to your show and others for credible news sites, and it comes to our nonprofits and our faith-based organizations and institutions to ensure that we have the right information and that we are most importantly taking care of ourselves.
Robert, to hear what these white supremacists are thinking about, I mean, this is one of the things we've heard experts always warn us about when it comes to people using biological weapons to attack people.
Well, let's appreciate, after reading up on their plan, this is one of the most high-level stupid plans I've ever heard. Because in order for it to work, you have to have somebody with coronavirus come to your meeting of other white supremacists and then provide bodily fluids full of coronavirus and then distribute it to your other members and then go find large groups of law enforcement or Jews, at which point in time you have already infected your entire neo-Nazi splinter cell with coronavirus. So by the time they get done coughing and hacking up and more likely going to the hospital, you won't have a neo-Nazi chapter to go infect people. So this is what happens when you get really stupid people together in a room to make stupid ideas. This is a Wile E. Coyote plan. This is the type of plan that you'll see on a Saturday morning cartoon. So I do believe the Trump administration does need to crack down on these groups. We do need to be vigilant of any groups along those lines, but they are far more likely to take out their entire cell of white supremacists before they infect anybody else.
And I ain't got no problem with dumbasses doing that. Knock yourselves out.
Like, y'all go handle all the coronavirus spit and sweat and pee you want, and then see how that works out for you. I'm sure all of you have like a bachelor's of epidemiology and a PhD in science, so you know exactly how to do this. It's one of the dumbest ideas I've ever heard. So I hope they try it, because more than likely we will have a good reduction in our white supremacist population.
Again, that's my whole point. I mean, I got no problem if they have coronavirus parties to take each other out. I'm good with that. All right, folks, back to our Roland Martin Unfiltered video in just one moment. All right. right, so a lot of y'all always asking me about some of the pocket squares that I wear. Now, Robert don't have one on. Nope. Now, I don't particularly like the white pocket squares. I don't like even the silk ones. And so I was reading GQ magazine a number of years ago, and I saw this guy who had this pocket square here, and it looks like a flower. This is called a shibori pocket square. This is how the Japanese manipulate the fabric to create this sort of flower effect. So I'm going to take it out and then place it in my hand so you see what it looks like. And I said, man, this is pretty cool. And so I tracked down, it took me a year to find a company that did it. And so they make these about 47 different colors. And so I love them because, again, as men, we don't have many accessories to wear, so we don't have many options. And so this is really a pretty cool pocket square. Now, what I love about this here is you saw when it's in the pocket, you know, it gives you that flower effect like that. But if I wanted to also, unlike other, because if I flip it and turn it over, it actually gives me a different type of texture. And so therefore it gives me a different look. So there you go. So if you actually want to get one of these shibori pocket squares, we have them in 47 different colors. All you got to do is go to RolandSMartin.com/pocket squares. All right, so first of all, that graphic is way too small. So tomorrow we're going to run it right down here all across the screen. So it's RolandSMartin.com/pocket squares. All you got to do is go to my website and you can actually get this. Now, for those of you who are members of our Bring the Funk fan club, there's a discount for you to get our pocket squares. That's why you also got to be a part of our Bring the Funk fan club. And so that's what we want you to do. And so it's pretty cool. So if you want to jazz your look up, you can do that. In addition, y'all see me with some of the feather pocket squares. My sister, who's a designer, she actually makes these. They're all custom made. So when you also go to the website, you can also order one of the customized feather pocket squares right there at RolandSMartin.com/pocket squares. So please do so. And of course, that goes to support the show. And again, if you're a Bring the Funk fan club member, you get a discount. This is why you should join the fan club. Now back to your Roland Martin Unfiltered video. You want to check out Roland Martin Unfiltered? YouTube.com/Roland S. Martin. And subscribe to our YouTube channel. There's only one daily digital show out here that keeps it black and keep it real. It's Roland Martin Unfiltered. See that name right there? Roland Martin Unfiltered. Like, share, and subscribe to our YouTube channel. That's YouTube.com/Roland S. Martin. And don't forget to turn on your notifications so when we go live, you'll know it. Right now, the White House is holding their daily news conference dealing with the coronavirus. Donald Trump is at the microphone. And as we tell you every day, we do not take him live because he lies far too much. We are not going to feed you fake information and lies. And so we will see what he says and then vet that after the fact. If any of the real experts like Dr. Fauci or Dr. Birx step to the microphone, then we will play that for you. Folks, as of today, there are 657,720 confirmed cases of coronavirus in the United States. 33,460 people have died from coronavirus. 53,322 are recovering. Now, that number dramatically increased in New York because of how they counted the folks who died. Now, New York State Governor Andrew Cuomo said that while there were 2,000 people diagnosed with the virus, the state also recorded the lowest amounts of deaths. He found hope in knowing that they can somewhat control the spread of the virus.
The number of new people who are diagnosed with COVID, about 2,000 still yesterday. So when you see the reduction in rates, remember what we're talking about. We're talking about a reduction in increases. You still have 2,000 people every day about who are walking into a hospital for the first time or who are being diagnosed with COVID for the first time. And 2,000 is still a lot of people. But the good news is it means we can control the virus, right? We can control the spread. And we did not know for sure that we could do that. We speculated that we could do it, but we didn't know. So now we know that we can control this disease. The bad news is 2,000 people walked into a hospital yesterday for the first time with the disease. And the worst news is 600 people died yesterday from the disease. That is still continuing at a really tragic rate. Of those deaths, 577 in hospitals, 29 in nursing homes. We've been watching the nursing homes because nursing homes in many ways are ground zero for this situation. Last night, the number in nursing homes was relatively low.
Now, folks, so many different things are happening when it comes to this coronavirus. How clueless is the Trump administration? Well, Donald Trump had a meeting today with the governors where he talked about giving them guidelines for reopening the country on May 1st. Then he creates this group, this working group of 36 members of Congress who are going to be on this committee. How do you create a committee of 36 people, not a single black member of Congress on the committee? No, seriously, per Politico, the White House reached out to 36 members of Congress. There's not a single African American in the group. Who's most impacted by this coronavirus? Black people. Joining me now, Dr. Greg Carr. He's the chair of the Department of Afro-American Studies at Howard University. Reese Colbert, Black Women's Views, and Brooke Thomas. She's the host of Controlling Our Narrative podcast. Glad to have all three of you on. I will start with you, Reese. Just saying, 36 members of Congress, which represents a little less than 10% of all the members, and ain't nobody black, not even Republican Tim Scott.
Well, Tim Scott says that he's going to be on the council, but it's obvious that he is an afterthought if he is in fact going to be on the council. But Tim Scott is the same person that said that the $600 extra a week that's included for unemployment on the federal level is going to incentivize people to stop working. And so he was opposed to that. So even, I don't want to say all skin folk and kin folk, but if the shoe fits, hey, we need real representation. We need an actual seat at the table. Regardless of how people feel about the Trump administration, the people who are a part of this task force are going to have some sort of influence on the policies. We have the largest congressional Black caucus ever. So they had, Congresswoman Maxine Waters is the chair of House Financial Services Committee. She's laid out an extensive economic plan for how to reopen the economy. That's a person that you would think he'd want to tap into and use as an ally. You also have on the Senate side, you have Senator Cory Booker and Senator Kamala Harris, who has put out plan after plan, bill after bill that addresses a wide variety of things. So why not tap into those people? It seems to me that, with the disparate treatment that we're seeing and the outcomes we're seeing in Black communities, it's going to continue because our interests are not going to be represented at the table.
Greg.
Yeah, no, I agree with Reese. I mean, this is, I respect Donald Trump and his clavering. They are pulling out all the stops. They've dropped all pretenses. On a day when we can look, and Newsweek just reported that the governor of North Dakota is saying that, they're going to try to reopen May 1st. And in South Dakota, neighboring South Dakota, the Smithfield Pork Factory in Sioux Falls is now outpacing Cook County Jail in Illinois as the biggest coronavirus hotspot. What do we see? We see that although in all fairness, the Smithfield Pork Factory in Sioux Falls, a lot of people who work there are immigrants, are non-white. But what we're basically seeing is white nationalism, as my friend and ancestor now, former colleague Ron Walters used to call it. They're circling the wagons. In a moment, when you see them trying to engage in voter suppression by doing everything from shortening the time that people can mail in votes to basically cratering the United States Postal Service, they realize they will never win another federal election. And so why keep up the pretense, whether it be the daily pep rally, press conference / campaign stops that Trump is doing from the White House, or whether it be this instance of putting together a committee with people who shouldn't be anywhere near it and then reaching out to Congress for your allies and ignoring everyone else. They're sending a clear message. The idea that this is a nation, always a fantasy, has now been dropped, and they are willing to sacrifice everybody. The only other thing I would say is that Donald Trump has realized, he doesn't realize this perhaps, and his supporters don't realize this, but everybody also means poor white people. Because as this disease, as this virus reaches those red states, some so-called flyover country, when you see death in those states, it won't be reported with the same type of ferocity and the same type of media attention that you're getting in New York or Los Angeles or Atlanta or New Orleans. And if that death, when that death reaches that level of crisis in those states, I wonder how those voters who are wearing those red MAGA hats will respond to this man who is clearly using them as a human shield to advance his political interests.
But, Brooke, here's the whole piece. I don't think they care about that. Do y'all have that soundbite from Laura Ingraham last night on her show? If y'all have that soundbite, I want to play it right now. This is literally what she said last night in terms of, well, people don't mind getting coronavirus. I mean, it's crazy. Then you have Dr. Oz, who makes his comment. And so I play either one of those where he's like, well, you know, we could reopen the schools and bring them back in as well. So let me know, play either one of those if y'all have it ready. All right, so let me just go ahead and pull it up myself, because this to me is crazy. All these people are pining, Brooke, for business to open back up, and I get it. I mean, look, we are impacted by what's happening economically, but this is Dr. Oz last night.
Dr. Oz, help us. Well, first, we need our mojo back. Let's start with things that are really critical to the nation, where we think we might be able to open without getting into a lot of trouble. I tell you, schools are a very appetizing opportunity. I just saw a nice piece in The Lancet arguing that the opening of schools may only cost us 2 to 3% in terms of total mortality. And, you know, that's any life is a life lost. But to get every child back into a school where they're safely being educated, being fed, and making the most out of their lives with a theoretical risk on the backside, it might be a trade-off some folks would consider. We need to get industry back, supply lines. I mean, things that we can do without putting the nation at risk. Dr. Oz, help us. So
you just heard him talk about this idea of 2 to 3%. Now, first of all, is he saying 2 to 3% of children? There are 57 million children who go to public schools. That's 1.2 to 1.6 million kids dying. Really, Brooke?
It's absurd. How do you say any life lost is a life lost? But how do you have a but to that? We're talking about lives. It's like, I think about it in a way of like the idea of choosing not to wear your seatbelt because only some people die when they go through the windshield. Even though we have a process in place, it's not the best right now. And no, it's not great for the economy, but we have a process, we have mitigation tactics in place right now that if people follow them, they will save lives. And that's all we have right now. We don't even have testing capabilities. What's been so frustrating to me about all of this, not even watching people who have such privileged lives talk about how it's not a big deal that people are going to die, that thousands and thousands of people, tens of thousands of people, hundreds of thousands of people, potentially millions of people could possibly die, that it's not a big deal because of the economy, blah, blah, blah. What's so frustrating is that this was a layup for Donald Trump. He could have simply taken any of the professional information that he was getting from doctors, from scientists, from experts months ago. He could have pushed these mitigation tactics into place, and now he would be sitting back saying, I told you so. Look at all of these other countries. I told you so. See, I am a good president. And everybody who hates everything about that comes out of his mouth would have had to been like, yeah, he's right about this one. And he didn't do that. And so now he's playing catch up, just trying to save face, and not at all. It doesn't seem to be worried about saving lives. And that's so frustrating. We are not at a place right now where we should be talking about forcing people at risk, people back to work, back to schools. We're not at that point right now. And it's so frustrating that everybody involved is not pointing out how ridiculous that is when anybody brings it up.
And what we're also dealing with now, what we're now dealing with are folks who are very good at lying, including his new press secretary, Kayleigh McEnany. Of course, you used to see her on CNN and this whole nonsense. She sent this tweet out here. As a result, the United States has now conducted more than 3.3 million tests, far more than any other country in the world. Okay, actually, if you look at per capita, South Korea has tested more. That's 3.3 million. Folks, that's literally 1% of America. Any scientist will tell you, any doctor will tell you, you cannot get enough data to understand the impact of this virus with only 1% of testing. And these folks are saying, let's just go back and again, back to group settings, putting people in environments at work. And you'll hear later in my interview with Dr. Regina Benjamin, they're still trying to figure this damn virus out.
Right.
This is, it's stunning to listen to these people as if, hey, it's going to be all good. Because here's the other thing. What now happens, Greg, if you get sick? What the hell? Who's paying those hospital costs?
Well, Roland, I think it's difficult for all of us because we've been raised in a society to think of the United States as a single entity. It's not true, not culturally, not socially. They're using what they have, which is the so-called bully pulpit, the propaganda element. So when you say accurately that 1% of the population of the country has been tested, we're thinking of the country as one place. But we've seen this week with the governors on the West Coast and the governors on the East Coast, they are in control. Someone has reminded or taught this fool in the last several days that he has no control. So he can put a talking head out there to say what you want. But at the same time, New York, Pennsylvania, California, Washington State will determine how best to approach the execution of what is a simple fact. People must be tested. Now, he doesn't control that. In Louisiana, there is a governor who will do that regardless of whether this corn-pwned senator who some claim had some kind of education at Oxford, John Kennedy, is running around saying, well, I got to open the economy. Okay, that's just talk. I guess what I'm saying finally, Roland, is that this type of campaign against public awareness will only be as effective as state and local leadership allows it to be, which means now, and you've been covering this, at the local level, when people go in the communities and say we have to be tested, we're going to have to meet them where people are, the garbage workers, the people working in the grocery stores. And when you come and say you must be tested, you got to now also help them overcome suspicion of government from Tuskegee and Henrietta Lacks and others. And those are local conversations. Ain't nobody listening to that white girl.
It is. And not only that, so Reese, check this out. In New Jersey, they got an anonymous tip. The police in Andover, New Jersey, went to a nursing home, saw a body being stored in a shed outside one of the state's largest nursing homes. When the cops showed up, they discovered 17 additional bodies piled inside the nursing home's small morgue, intended to only hold no more than 4 people. 17 people they discovered, 68 deaths total linked to this long-term care facility, and then a number of people also sick. Here's the deal. Other people who died, including 2 nurses, also tested positive. Cause of death is unknown. Of the patients who remain at the homes, which is housed in 2 buildings, 76 have tested positive for the virus, including 41 staff members, including an administrator. Let's go to Florida, where Governor Ron DeSantis, he wants to give nursing homes immunity from being sued. It's stunning, Reese, what is happening here. They are treating like, oh, don't worry about it. Don't worry, we'll cover you from being sued. Don't worry about these deaths.
You know, it's absolutely stunning, the neglect, the cruelty, the apathy that this administration has towards people in nursing homes. Frankly, the Republican base is quite old. I don't mean that in a pejorative way.
Yeah.
They have an older demographic. what message are they sending their demographic? If for no other reason for electoral survivability, they want to get a lid on this. And the fact that they don't even give a shit about these folks should be a red fire alarm for everybody else. It's absolutely disgusting. It goes to the fact that we don't have a handle on the amount of carnage that is being caused by this virus. It also goes to the point that Republicans have said it's okay if people in nursing homes die. It's okay if we bring the kids back to school and they die. But I can tell you, every single person that I've seen in the news, once they have been personally impacted by it, they change their tune.
Right.
When you have the pastors, for instance, that said, I'm gonna, hold church or whatever else, or this is a hoax, and they die, their family says, take this shit seriously. And so it's not until it hits close to home for some of these folks that it's going to really, really drive home the point that this is a public, global, with Donald Trump attacking the World Health Organization, with him attacking the blue states versus the red states. This is a global and national public health crisis where we have to be united. We have to actually address the problem. Donald Trump cannot bluster and bullshit his way out of this coronavirus pandemic. We need a competent and empathetic and long-term and immediate action on this. Testing, PPE, all of these things. And the fact that they keep lying about it is really scary, because that means that they're not taking action on it. And that's what we need right now. We need action, not bullet points and not bluster.
Here is Laura Ingraham last night talking about this. I'm trying to figure out, Brooke, why in the hell is she smiling? Watch this.
Okay. Life is filled with risks, in other words. We should all be careful and we should all be responsible, but the government cannot, nor it really should try to eliminate all risks associated with COVID-19 any more than it could with the H1N1 or the swine flu. When we step out of the door, when we walk onto the streets, we enter a building, we get into a car, get on a bike, there are always relative risks. But the damage to millions and millions of lives, including children's lives, and our basic freedoms during the shutdown, that's also very real. And for many, it has been absolutely devastating. Many are willing to take the risk of contracting the virus. We've seen that in the polling, frankly, what they rate as more worrisome to them. And they would risk this in order to preserve their way of life. Oh, okay. Life is filled with risks.
Okay, I'm trying to understand. Kill the audio, guys. So I'm trying to understand, Brooke. They're willing to risk that to preserve their way of life. Yeah, until they get sick. Until all of a sudden they begin to realize that, oh, I didn't even realize. So I might have it and I don't know it, and I might infect you, but then you have a pre-existing condition. Now all of a sudden you're worse off, and I can also spread it and have no idea. And that's really what the problem is. I mean, look, here's the whole deal. When somebody has the flu, we know they have the flu. When somebody has the flu, they are sniffling, coughing, wheezing. You can see throat, you can see it in their eyes, they're fatigued. There are people with coronavirus who are asymptomatic. You do not. I have never met, Brooke, somebody with the flu who said, I didn't know I had that damn thing.
Right.
I couldn't feel nothing. No, you know when you have the flu. And that's what the issue here. And I think, and I'm telling you right now, all these people can say whatever they want to say. I'm gonna tell you right now, millions of Americans gonna be like, y'all go ahead on out there. Go on. Y'all go ahead. Go on, kill yourself. I'm gonna keep my ass right here while y'all go kill yourself. Brooke, go ahead.
Yeah, absolutely. And you know what else is different about this is that when people have a mild case of the flu, and I obviously think everyone should get flu shots. Everyone should do what they can to protect themselves from the flu during flu season, because the worst case scenario about the flu is death. And nobody wants that. That's the worst case scenario. But a mild case of the flu feels like a bad cold, right? A couple body aches, you're sniffling. That's a mild case of flu. I've had a bad flu, not the worst flu. But there are mild cases of this where people are talking about lying in their beds for 10 days feeling like they can't breathe. This is terrifying. This is not something that people should be taking lightly. And I would rather be poor than dead. I would rather be poor than my mother be dead. I would rather be poor than my sisters or my brother be dead. I can't, this is not a choice. This is a simple choice to me. Also, her argument that the government should not be protecting people from risk of a deadly virus, that is absurd. The government should absolutely be protecting the people that they're there to represent. This is simple. The government should not be bailing out big corporations that should be able to handle their bills and then just forcing people who can't pay their rent back into dangerous positions. And think about all of like the essential workers right now who have never been paid enough. It is the responsibility of everyone who has the privilege to practice these mitigation tactics to protect them. So it's just, this is so frustrating for me. Like, she is spinning 30,000 deaths as some sort of a win.
And now they're also trying to spin this whole deal. Trump at this little news conference saying nationwide more than 850 counties or nearly 30% have reported no new cases in the last 7 days. I don't trust their numbers at all. But here's the flip side. 70% are. Go ahead, Greg. Go ahead, real quick.
I'm going to say very quickly, echoing what Brooke is saying. The state should be taking care of its citizens, but they're breaking it down by county because many of those counties got a handful of people in them in those red states. And as you said, you know who's listening to Laura Ingraham? Those people in Nebraska, North and South Dakota, in those rural areas, and they're going to get sick. Now, they can listen. While we're looking at why is she smiling? She's smiling because she knows anything she says they're going to listen to. And they're going to listen to her to their sickness and their death. Meanwhile, the rest of us, to your point, hey, stay yourself in place. This is going to be a very different country by the time we come out of this, brother.
Absolutely. You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily possible. Welcome back to the news conference. Dr. Fauci speaking. Go.
We have multiple different countries that have gone through various phases of their individual outbreaks. And you could learn something from them about where you are in your own outbreak. For example, when China went up, what happened is they just didn't turn around. They went from going to, I'll just take an arbitrary number, 500 new cases a day. The next day it was 1,000 cases, then 1,500, and then 2,000. But once the number of new cases each day starts to flatten out, that's when you get to that point where the inflection goes down. So what things we want to look for, the things that Dr. Birx had mentioned. That doesn't mean you declare victory when it does that, but you know you're at least on the way to where you want to go. And I think that's really very important. The third and final thing that I think gets back to the question that many of you in the audience have asked of us is about, would this possibly become a seasonal cyclic thing? And I've always indicated to you that I think it very well might. And the reason I say that is that what we're starting to see now in the Southern Hemisphere, in Southern Africa, and in the Southern Hemisphere countries, is that we're having cases that are appearing as they go into their winter season. And if, in fact, they have a substantial outbreak, it will be inevitable that we need to be prepared that we'll get a cycle around the second time. What does that mean for us and what we're doing? It totally emphasizes the need to do what we're doing in developing a vaccine, testing it quickly, and trying to get it ready so that we'll have a vaccine available for that next cycle. In addition, to do the randomized controlled trials of drugs so that we will have a menu of drugs that we have shown to be effective and shown to be safe. Because I know we'll be successful in putting this down now, but we really need to be prepared for another cycle. And what we're doing, I believe, will prepare us well. Thank you.
Thanks, sir. We'll take a few questions.
Mustafa, point there again. Let the damn experts lead.
Mm-hmm. I mean, Dr. Fauci, everybody has a lot of respect and trust that he's always going to give you some real talk. And then, you know, whether it's good news or challenging news, that he's going to share it with you in a very straight sort of way. But the other part that he shared, you know, when he was talking about numbers and using the example in China, you know, we got 360 million people in this country. And so far, you know, we've just had a handful of folks who are being impacted when you look at that larger number. So We need to get prepared. We need to make sure that social distancing is something that we're incorporating in a real way. As they say, we need to flatten out the curve. But we've also got to be extremely focused on our most vulnerable communities, because they are the ones that are going to get hit extremely hard. Lives will be lost, but also long-term types of situations are going to come out of the needs that are there around folks in economic situations, their health, the costs that are going to come out of this. So we got to just be focused.
All right, folks, back to our Roland Martin Unfiltered video in just one moment. All right, so a lot of y'all are always asking me about some of the pocket squares that I wear. Now, Robert don't have one on. Now, I don't particularly like the white pocket squares. I don't like even the silk ones. And so I was reading GQ magazine a number of years ago, and I saw this guy who had this pocket square here, and it looks like a flower. This is called a shibori pocket square. This is how the Japanese manipulate the fabric to create this sort of flower effect. So I'm going to take it out and then place it in my hand so you see what it looks like. And I said, man, this is pretty cool. And so I tracked down, it took me a year to find a company that did it. And so they make these about 47 different colors. And so I love them because, again, as men, we don't have many accessories to wear, so we don't have many options. And so this is really a pretty cool pocket square. Now, what I love about this here is you saw when it's in the pocket, you know, it gives you that flower effect like that. But if I wanted to also, unlike other, because if I flip it and turn it over, it actually gives me a different type of texture. And so therefore it gives me a different look. So there you go. So if you actually want to get one of these shibori pocket squares, we have them in 47 different colors. All you got to do is go to RolandSMartin.com/pocket squares. All right, so first of all, that graphic is way too small. So tomorrow we're going to run it right down here all across the screen. So it's RolandSMartin.com/pocket squares. All you got to do is go to my website and you can actually get this. Now, for those of you who are members of our Bring the Funk fan club, there's a discount for you to get our pocket squares. That's why you also got to be a part of our Bring the Funk fan club. And so that's what we want you to do. And so it's pretty cool. So if you want to jazz your look up, you can do that. In addition, y'all see me with some of the feather pocket squares. My sister, who's a designer, she actually makes these. They're all custom made. So when you also go to the website, you can also order one of the customized feather pocket squares right there at RolandSMartin.com/pocket squares. So please do so. And of course, it goes to support the show. And again, if you're a Bring the Funk fan club member, you get a discount. This is why you should join the fan club. Now back to your Roland Martin Unfiltered video. You want to check out Roland Martin Unfiltered? YouTube.com/Roland S. Martin. And subscribe to our YouTube channel. There's only one daily digital show out here that keeps it black and keep it real. It's Roland Martin Unfiltered. See that name right there? Roland Martin Unfiltered. Like, share, and subscribe to our YouTube channel. That's youtube.com/Roland S. Martin. And don't forget to turn on your notifications so when we go live, you'll know it. You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real. It's Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible. Want to pull the phone right now, Reverend Dr. William J. Barber, of course, one of the national conveners of the Poor People's Campaign. Reverend Barber, it is stunning to watch the sheer and utter incompetence coming out of the White House every single day. You also look what's happening on Capitol Hill, where you have the debate going on there. The Democrats, for the second time, have voted against cloture, and so therefore the bill that the Republicans want them to vote on, they are desperate for that to move forward. Mitch McConnell is really upset, blasting Democrats, talking about how they are, failing America and all of this sort of stuff. In fact, I want to play for you something that Mitch McConnell said that I want you to comment on this, Reverend Dr. Barber. So, folks, here's Mitch McConnell. Check this out, y'all. This is today.
On the Democratic wish list over which they choose to block this legislation last night. Tax credits for solar energy and wind energy. Provisions to force employers to give special new treatment to big labor. And listen to this. New emission standards for the airlines. Are you kidding me? This is the moment to debate new regulations that have nothing whatsoever to do with this crisis? That's what they're up to over there. American people need to know it. Democrats won't let us fund hospitals or save small businesses unless they get to dust off the Green New Deal. I'd like to see Senate Democrats tell New York City doctors and nurses.
Reverend Barber, they're complaining because Democrats say there's too much pork, if you will, in this bill. What say you when you listen to the whining and complaining of Senate Majority Leader Mitch McConnell? In this bill, what say you when you listen to the whining and complaining of Senate Majority Leader Mitch McConnell? In this bill, what say you when you listen to the whining and complaining? Hold on one second. We've got some cross audio going, and so guys, hold on one second. So let's go ahead and fix that. Okay, Reverend Barber, we're hearing some cross audio. So on your end, if they could turn down or just turn down the audio from the show, then we can actually hear you. Okay, go right ahead.
So first of all, Mitch McConnell is lying. One of the main issues is that they want to give $500 billion to corporations without any riders on it, the Trump administration, once again focusing on the corporation and not on the community, not on the poor, not on the working poor, and not on the people who are on the front lines. And he knows that. When he calls it a wish list, for instance, strengthening health care for him is a liberal wish list and not something we need to do to save lives. Making sure people have money. You know, they don't even really want to give the meager amount of $1,000 because in one of the bills, they even make that so that the money that you get went down, the poorer you are. So this is, again, Republicans who want to make money off of people suffering, who believe the answer to every problem is trickle-down economics. Just give it to the corporations. You even heard Trump say he doesn't want to nationalize certain things because, quote unquote, he sees that as socialism, when in fact we have plenty of socialism for the wealthy and the greedy. The other thing is McConnell, if you look at 2 million poor people in Kentucky, and he isn't even looking out for them because all he's concerned about is the corporate donors. That's all he's concerned about. And then the third thing, Roland, what I'm concerned about is, now if McConnell was up there arguing to get more judges that were against a woman's right to choose, you'd have all these white evangelicals and religious folks just jumping and supporting it if he was talking about being against gay people. But when he's talking literally about passing a bill that's going to hurt poor and working poor people and not really protect us and not strengthen health care, you don't hear anything from them. Not one word. What he is doing is a scandalous and sinful use of political power. It is abhorrent to see what it's doing. It's abhorrent to see what Trump is doing, and the fact that one good thing about it is a good thing, is that we are seeing in living time that anybody who just says Trump, Trump, Trump doesn't understand the depth of this craziness. McConnell, in some ways, is worse than Trump and more powerful than Trump because the legislation has to come through him. And just getting rid of Trump is not going to be enough for this democracy. It's going to have to be a total reset.
When you look at what the Senate, I listened to some debate earlier, and Susan Collins was railing against Democrats and John Kennedy, and all of them were just railing against him. For you, what should this bill look like? Should it be first, let's deal with the workers, or when you hear Trump say, "Oh no, we got to help the airlines and the cruise lines, and we got to help Boeing," and I didn't hear him say we got to help the employees of Boeing. It was like, we got to help Boeing.
Nope, and that's the point. They want to give more money to the same people that took the other tax cut and basically bought their own stocks. That's their side. But now we have to understand, throughout history, there have been those who were cynical enough to make money off of people's hurt. There were a lot of people that made money during the Great Depression. You know, when Roosevelt pushed to pass Social Security, there was some that said, don't put it with the agrarian culture and the domestic culture, left out 50% of white women and almost all black people. But you don't hear them saying, let's protect the nurses' aides and the nurses. And I'll tell you another group, let's protect the janitors who have to clean the soil piece. We're talking about people who are at risk. Let's protect the maids. Let's protect the sanitation workers. Let's make sure everybody has a living wage. Let's make sure, and not just for 3 months, but permanently. Let's make sure we make permanent paid sick leave and time off. You don't hear them arguing for those things. It's all about we have to do this $500 billion. Now, remember, that's $500 billion on top of already $1.5 trillion that they found overnight. And isn't it amazing, Roland, that when Bernie Sanders or Elizabeth Warren were talking about Medicaid for all, the whole argument by Democrats and Republicans is we don't have the money. We can't find the money. And isn't it amazing that they want to give all this money to the airlines and the cruise liners, and some of the cruise liners don't even have their offices in America, by the way. But this same group, McConnell, if you go back in history, they were the ones that cut the money to the community health centers. My daughter is a PhD in public health, and she said, Dad, it's not just that we don't have the money, we don't have the infrastructure because of all the ways in which extremists who call themselves Republicans cut community funds, cut hospital funds, block health care, and now we don't even have the infrastructure to deliver what the people need.
So talk about this digital campaign where the Poor People's Campaign is launching.
Well, we're launching a major digital campaign. We have what's called a moral response to poverty and pandemic, and we put it together with some leading thinkers. And what we should be doing both permanently, temporarily and permanently, is online now. You can pull it. We did it with MoveOn.org. We've had thousands of people to sign on, have 250,000 people the other night come on and go through it, and we've loosed them to call McConnell, call Schumer, call Pelosi. We believe it's having some impact, too, because now Pelosi is saying, well, we're going to write our own bill. You know, we're turning people along digitally. And on June 20th, we now know we have to have a mass Poor People's Assembly and a national moral march on Washington. But we're going to learn from you, Roland. Instead of we can't do it, you know, that they shut down D.C., no large gathering. So we're going to have the largest gathering online. We're going to have hundreds and hundreds of thousands of people online on June 20th, 2020, mobilizing towards that, putting the face of poor and low wealth people. You know, we're right now, we cannot wait, Roland, another 2 years to then come back and analyze this and show the inequity. So we're working with two think tanks, one out of Harvard, one out of UCLA, and one out of D.C., examining the inequities right now and challenging Democrats and Republicans. And in June, we're going to have a mass gathering to continue to push the agenda we were pushing before the crisis. Here's the last comment, because what we have to say is the crisis did not start for a lot of people in the end of February, March. We were losing 700 people a day from poverty before the pandemic already happened. 250,000 people a year, 140 million people poor and low wealth, before there was ever a germ. The pandemic has exposed the already existing fissures and crisis in our society. And so we're going totally digital for this mass, but we can't. Somebody said, why don't you postpone? We can't postpone. The last thing we can do now is postpone. The thing we must do is stand up and speak out, particularly for the 140 million, 43% of this nation that are poor and low wealth, that are not being dealt with in most of this legislation.
Well, especially since, of course, the election is still going to go forward. I mean, there will be an election in November.
That's right. And that's why we said June 20th. We're mobilizing to June 20th so we can organize after June 20th. We're mobilizing people not only to tell their stories and shift the narrative, but to build power. We have a study coming out. I hope we can release it on your show.
Absolutely.
And that study is going to show what will happen, what could happen if just 2 to 3 to 5% of poor and low wealth people were organized, mobilized around an agenda, and they voted. It could fundamentally shift. In fact, the margin of victory to move McConnell lies in organizing poor and white folk in the mountains and black folk in the cities of Kentucky. And the margin of victory exists among poor and low wealth people who are not voting, not who are voting, who are not voting because they are not hearing politicians deal with their issues, which is why we're challenging Democrats to stop backing up. They need to make McConnell and them have to, if they want to vote stuff down, let them. But don't go in a back room and negotiate out. That's one of the things we have to say to Schumer and to Pelosi. Put a bill together that's what we need. Put it before them and make them vote on it. Don't negotiate poor and low-wealth people out and give in to the bullies and the corporations. We can't do that.
All right, then, Reverend Dr. William J. Barber, we surely appreciate it. Thanks for being with us. Anything you need in the future, be sure to let us know. We'll be right here.
Bless your heart. Thank you, Doc.
Thank you, sir. Appreciate it. All right, folks, back to our Roland Martin Unfiltered video in just one moment. All right, so a lot of y'all are always asking me about some of the pocket squares that I wear. Now, Robert don't have one on. Nope. Now, I don't particularly like the white pocket squares. I don't like even the silk ones. And so I was reading GQ magazine a number of years ago, and I saw this guy who had this pocket square here, and it looks like a flower. This is called a shibori pocket square. This is how the Japanese manipulate the fabric to create this sort of flower effect. So I'm going to take it out and then place it in my hand so you see what it looks like. And I said, man, this is pretty cool. And so I tracked down, it took me a year to find a company that did it. And so they make these about 47 different colors. And so I love them because, again, as men, we don't have many accessories to wear, so we don't have many options. And so this is really a pretty cool pocket square. Now, what I love about this here is you saw when it's in the pocket, you know, it gives you that flower effect like that. But if I wanted to also, unlike other, because if I flip it and turn it over, it actually gives me a different type of texture. And so therefore it gives me a different look. So there you go. So if you actually want to get one of these shibori pocket squares, we have them in 47 different colors. All you got to do is go to RolandSMartin.com/pocket squares. All right, so first of all, that graphic is way too small. So tomorrow we're going to run it right down here all across the screen. So it's RolandSMartin.com/pocket squares. All you got to do is go to my website and you can actually get this. Now, for those of you who are members of our Bring the Funk fan club, there's a discount for you to get our pocket squares. That's why you also got to be a part of our Bring the Funk fan club. And so that's what we want you to do. And so it's pretty cool. So if you want to jazz your look up, you can do that. In addition, y'all see me with some of the feather pocket squares. My sister, who's a designer, she actually makes these. They're all custom made. So when you also go to the website, you can also order one of the customized feather pocket squares right there at RolandSMartin.com/pocket squares. So please do so. And of course, that goes to support the show. And again, if you're a Bring the Funk fan club member, you get a discount. This is why you should join the fan club. Now back to your Roland Martin Unfiltered video. You want to check out Roland Martin Unfiltered? YouTube.com/Roland S. Martin. And subscribe to our YouTube channel. There's only one daily digital show out here that keeps it black and keep it real. It's Roland Martin Unfiltered. See that name right there? Roland Martin Unfiltered. Like, share, and subscribe to our YouTube channel. That's YouTube.com/Roland S. Martin. And don't forget to turn on your notifications so when we go live, you'll know it. You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real. It's Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible. Y'all, watch this coronavirus drama. Lots of scams out here. Tyler Perry just dropped this video, and I was just texting him saying I was going to play this video. So listen to this.
Everybody, hate to come on and say this, but I'm pretty annoyed and you know, people are so wicked and so evil, and to think that they're setting up all of these fake sites asking you to send them money because I'm giving away thousands of dollars. It's just downright evil, downright wrong. I wish Instagram and Facebook and Twitter would do a better job at taking some of this stuff down, especially at a time like this, because no sooner than we report 10, there's 10 more that are popping up. Please, 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 especially, you know, the people who have been supporting me all these years. Times are hard. They're tight right now. People are really, really struggling. Don't fall for this. Do not fall for this. Do not send anybody money thinking that I'm sending money. Do not fall for that. Those are all lies. They're all fake sites, okay? Listen to me. Everything that I'm doing, and I'm doing a lot to help a lot of people, I'm not asking anybody for anything to do that. I think to whom much is given, much is required. So please do not fall for the fake sites. You want to know what I'm doing? Check out my verified sites here, this Instagram, this Facebook, this Twitter. Don't fall for the foolishness, guys. I can't believe people would be this wicked, but they are, and I promise you they will reap what they sow. So don't fall for it, please. Please do not fall for any of these fake scams saying that I'm giving away money and to send something to them. Please.
Scott, is that video okay?
Oh, it was perfect, and he's a very legitimate multimillionaire doing incredible things for the African-American community as well as politically.
Okay, so...
He didn't have purple hair.
Well, so we just want to be... Well, he dressed as Madame Medea. Really? Really?
He dressed like a professional black man.
That's the problem. That is the problem. There within lies the problem. We are saying not come as you are, but you need to come with a specific uniform. And that is what draws a lot of people who feel like they don't have a fit in this political space. I tell people all the time, the very act that they were born is an act of politics. You are born into politics. And so wherever you take up space, there you are rightfully there to take up space. Look at Donald Trump. With you. He is a slob who is the president of the United States. He doesn't appeal. He doesn't have the look. He's not presidential, but there he is leading our country. And so I think we do ourselves we do ourselves a disservice as well when we say to folks that even as they begin to really yearn to understand what is happening in these complex pieces known as politics, to say that, well, if you are going to actually engage in something that you're born into, that this is the way that you should look. Hell, I mean, I have locks. And so for the longest time, I was, told that there were certain things that I shouldn't or could not do because of the way that I chose to wear my hair, because of the way that it grows naturally out of my head. I discounted that because I know better and I've been grounded well. And so again, for the Cardi B's, unlike Killer Mikes, who are actually using their platforms and talking to people and not telling them not to vote top of the ticket, but just to concentrate on their state and local governments, but that is actually curious and asking questions that I'm sure many of her people that follow her are curious about, that she's actually doing the work of folks who are engaged in politics.
One of the things, Teresa, that Tyler Perry speaks to is that this is a time where the scam artists really go into overdrive. I had a fool last night trying to impersonate a marketing company, trying to get me. And first of all, y'all, here's the first thing. If a so-called company is reaching out to you and they using a Gmail. No, I'm just gonna walk y'all through. So let me just help y'all out. The first thing, y'all, I just want y'all, don't just get excited and jump at something. First thing you need to do is you need to look at what they write and go, okay, why are you with this company, but you're using a Gmail? I then sent an email to them and I said, okay, why don't you send me your office number so my sales staff can follow up? Oh, no, we're not allowed to give out numbers.
Ding, too.
US numbers anyway.
Y'all, ain't no real company not allowed to give out phone numbers, okay? That's just one right there. And then their email, because they emailed me twice and I ignored them. Then they said me the third time, are you going to answer our emails? I was like, let's see what these fools talking about. And so I'm like, so what kind of ass y'all talking about? And they sit here and they emailing me at 2 or 3 o'clock in the morning. It was hilarious. and what they
third stop sign.
What they were trying to do, it was really Anthony, go to my iPad. You'll see. We cannot share our personal number and email, etc. So y'all, and the email is right here. Let me go. Y'all go ahead and look at it right there. WNEYROZE@gmail.com. Lying asses. And
Put 'em
so,
on blast.
yeah, I'm gonna put them on. So I want y'all all can send an email to WNEYROZE@gmail.com and say you punk ass fraud. And so what I did was I emailed. First of all, you see, they tried to say they were EVOC advertising, EVOK. So y'all come back to me. So what I did was I go to the website for EVOC advertising. Type in the name. Ain't no name. They had a number of other people who work for the company. So I sent them emails saying, is there somebody by this name working at your company? And so they responded this morning and they said, report them to Google phishing. Because see, y'all, here's what they were trying to do. They were trying to claim that they can place advertisers with ads on my Facebook page. And what they try to do is they try to get you to give up your username and password. That's phishing. And so what Tyler Perry is talking about are these similar scams out here where people set these things up saying Tyler Perry is creating a coronavirus relief fund. You give. Tyler already saying, I don't need no relief fund. I am the relief fund. And that's what you're seeing. And so I just want everybody out there, you need to be extra careful. I know people are hurting for money and they think people are doing good, but you need to verify, check, always do all of that. And if somebody tell you we can't send you our number and it's against company policy, that's the biggest red flag that it's a scam. It's a scam. And also, I get these emails saying you have violated Facebook standards. I want all of y'all watching to do this. Anytime you get any kind of email like that, do not click in the body. Check the email first. Check the email first. Because if it says Facebook at G765CRLU.mail, it ain't real. And so there are a lot of people, Teresa, who get in trouble with these scams because they start clicking in the body of the email, which then goes to whatever that site is. And what they're doing is they're then trying to capture your data to get you to put your username and password in. And a lot of people have lost money on these type of scams, Erica and Scott.
Erica,
Yeah, absolutely.
you want to go first?
And you talked about how, even though this is a very emotional time, that this does actually means that people need to heighten their discernment and their due diligence. So I think those are great points. But to also check your junk mail, your spam mail, because oftentimes a lot of those messages filter into your spam or your junk mail, and maybe one will be able to sneak over into your inbox. So again, for people really to exercise due diligence, there is no need to be giving out any personal information, either on the phone, by text, or by email. And then the last point, you talked about verify, but it is, again, verify, verify, verify.
My golden rule, Roland, is if something looks suspicious, then you got to verify, and it is suspicious. And don't respond, don't click on the app or whatever that icon is. Just don't do it. One of the things we do at Reed Smith is we have an IT group that sets us up. They send phishing emails to us to test us. And if you open it up, you get a ding letter. And if you report it to IT, then, you beat the phishing exercise internally. But it's used with law firms. It's used generally. But you just got to be careful. Because you can really embarrass yourself. Worse, your bank accounts and your credit cards and your personal information can really be absconded with, and getting that back and getting it off the black internet, or the dark internet rather, is just a headache without a doubt. So I support what you're saying and all of our colleagues who are on this show right now.
Teresa, go ahead. She there?
I'm here.
Go ahead.
Last and final comments. Everything that you said, and Erica and Bolden brought up phenomenal points. Scott, sorry.
Scott.
Scott Bolden. Let me do my public
I'm
service
D. Scott
announcement.
now.
Aloysius Scott Bolden. Go ahead.
Yeah. Yes, everything you said is absolutely true. But I just want to add another note. It's not only email. You're going to be getting these type of spam phishing through your social media accounts. So your LinkedIn, they are they're populating on the messenger portion because it is almost like an email. And they're doing it through there as well. So you'll get it between, if you're Eastern time, probably midnight to 3 a.m. So anytime you're getting, an app developer or somebody reaching out saying, click here to learn more, just pay attention to your message inbox specifically on social media platforms.
Every single night. We've got some of the top black experts. You're not going to see them on cable news or broadcast news because you swear black people aren't experts when it comes to this health crisis. That's why we have this show and why we do what we do every day on Roland Martin Unfiltered. Joining us right now is retired General Russell Honore, the nation's first black Surgeon General, Dr. Joycelyn Elders. John Hope Bryant, he is the founder of Operation Hope. Senator Kamala Harris of California, Dr. Cedrina Calder, retired General Lloyd Austin, Congresswoman Karen Bass, Commissioner Omari Hardick, Bureau President in Brooklyn, Eric Adams, Dr. Joseph Graves, America's Wealth Coach, Deborah Owens, Dr. Corey Hebert, Patel Salt, Howard University student, Pastor Jamal Bryant, Dr. Christy McDowell, Benja Ajilore, senior economist at the Center for American Progress, Gilda Daniels, again, author of the book, The Crisis of Voter Suppression in America. 4 stars, General Kip Ward, Dr. Oliver Brooks is president of the National Medical Association, president of the American Medical Association, Dr. Patrice Harris, Joby Benjamin, Dr. Alexia Gaffney, infectious disease specialist, Dr. Georges Benjamin, executive director of the American Public Health Association, Malcolm Nance, family medicine physician, Dr. Jen Caudle, Dr. Tashaka Cunningham, a molecular biologist, Kat Stafford. She's a national race and ethnicity reporter for the Associated Press. Dr. Wayne A.I. Frederick, who is the president of Howard University, Congresswoman Yvette Clarke from the state of New York, William Spriggs, AFL-CIO economist, Andrea James, executive director of the National Council for Incarcerated and Formerly Incarcerated Women and Girls. All right, let's go to Capitol Hill. Congressman Gregory Meeks, Congresswoman Eddie British Johnson of Texas, Congresswoman Barbara Lee, Minnesota Senator Amy Klobuchar, mental health clinician Jamie Singletary, Prince George's County State's Attorney Aisha Brayboy, as well as Dylan Hayrie, ACLU Justice Division strategist. Dr. Cindy Duke, she is a virologist. Principal Steve Perry of Capitol Prep. Health and wellness specialist Dr. Yolandra Hancock. Desmond Meade, president of the Florida Rights Restoration Coalition. Cliff Albright, who is the co-founder of Black Voters Matter. Michael Harriet with the Root. Mina McWhorter, founder of Love by the Hand. Dr. Julianne Malvo, economist, president, Emerita Bennett College. Coroner Michael Fowler is the mayor of Atlanta. Keisha Lance Bottoms, mental health therapist Suzette Clark. Justin Gibney, attorney and political strategist, and Bishop Vincent Matthews Jr. Dr. Suzette McKinney, CEO and executive director of the Illinois Medical District. Dr. Leon Madugal, president-elect of the National Medical Association. Jana Bailey, mayor of Moss Point, Mississippi, Mario King. We're going to keep driving this thing to make sure our people are fully aware, safe, protected from coronavirus. You're getting the top medical experts, the top business experts, top political experts, top religious experts, because that's why we do what we do. Unapologetically and unfiltered. Ain't nobody else in the black media space doing what we do. Watch Roland Martin Unfiltered daily at 6 p.m. Eastern on YouTube, Facebook, or Periscope, or go to RolandMartinUnfiltered.com. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com. You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. Roland Martin Unfiltered. Just so you understand why we don't take these news conferences live. We just missed Dr. Fauci. We'll try to pull his clips up. Go to my iPad. Sam Stein just tweeted this. He's with the Daily Beast. He said, Trump just now touting 3.5 million tests completed. is a weird boast because on March 4th, Mike Pence pledged 4 million tests by the end of that week. In fact, if you see the bottom of this, the White House promised 27 million coronavirus tests by the end of March, but just hit 1 million. So here we are in the middle of April, and they're saying, hey, 3.5 million tests, when y'all said we're going to have 4 at the end of 1 week. Let's talk about what's happening on the business side. Facebook is offering $100 million in cash grants and ad credits to help during the coronavirus pandemic. Up to 30,000 eligible small businesses in more than 30 countries where they operate will be able to receive the grant. Now, to be eligible to apply, you must be a for-profit company, have between 2 and 50 employees, have been in business for over a year, have experienced challenges from COVID-19, be in or near a location where Facebook operates. Now, they have, now if you go to facebook.com/business/boost/grants. You can see the information, and they have it based upon also cities, and I think it's like April 18th. If you're in New York City and Seattle, then there's another date for San Francisco, and then there's another date, April 22nd, for the rest of the cities. And so again, if you're a small business, put it back up. You can apply for these grants. The folks at Facebook sent this to me, facebook.com/business/boost/grants. Now, we've been talking about the PPP program, which Congress passed that $350 billion to help small businesses. The SBA, the Small Business Administration, announced today it is out of money for firms seeking loans. They said in a statement, quote, the SBA is currently unable to accept new applications for the Paycheck Protection Program based on available appropriations funding. Similarly, we're unable to enroll new PPD lenders at this time. The statement comes as lawmakers on Capitol Hill are wrangling over replenishing the program. Now, here's the other issue that we're dealing with. I'm going to talk about this with my next guest, John Hope Bryant, the CEO of Operation Hope. This was set up for small businesses. Politico, we talked about it yesterday, reported that Potbelly and Ruth Chris Steakhouse have received the maximum, remember, for this program of $10 million. That Potbelly and Ruth Chris Steakhouse, 2 chain restaurants, were able to qualify under this program. Does that sound like a small business to you? Let's bring in John Hope Bryant, with CEO of Operation Hope. John, you came on the show. You talked about what was important for African Americans. Obviously, this was a huge program, $350 billion. Congress is now realizing that that wasn't enough money.
Correct. Yeah. So first of all, Roland, thanks for continuing to be a voice for all of us. Which topic? And by the way, Dr. Regina Benjamin, who is a dear friend of mine, served on the Operation Hope board for years and is doing incredible work in the South. Is just a beacon and a light for our community. Former Surgeon General. So obviously, you're showing enormous great taste in having her on. Which thing do you want to cover first, Roland? Because, you know,
first and foremost, the fact that they announced today that the program has run out of money. They're not processing applications. They're not even pulling in more banks. I'll just give you an example. Northern Trust is my bank. I don't have a loan with any bank. That's who I bank with. They've applied for the program, haven't even heard back whether they got accepted. So, we can't even file because with this program, you got to have a bank to actually go through to file for it. Go ahead.
Yeah, I just don't know, I don't know in which direction we should go first. I'm very rarely at a loss for words, but I both am sharing in your frustration about all that we're not getting, and I'm also frustrated that we didn't go get the thing that was right in front of us. That's the biggest giveaway program of the federal government ever. It was free money, effectively. I know because I helped design some part of the program, as you know, and we just weren't ready. Now, I guess I can say this on your show. I'll frame it because it's who could be watching. Was it a crap show? You don't want to say something else. Of course it was a crap show. The federal government stood up the 10th largest bank in America in 30 days, 20 days. Of course it's a mess. Ready, fire, aim, programs changing every 28 seconds. Nobody's happy. But, they did push out, 1 point whatever million loans. The 2/3 of the loans are $150,000 or less. I know I checked myself. I couldn't find out what the ethnic race was because they didn't put that on the form. I'm sure that was not an accident, but can't figure out what race it is. But at least 2/3 of the loans are below $150,000. And, the folks who work for Ruth Chris Steakhouse are going to be mostly working class people who you and I know. So I don't have a problem with that, actually. The problem I have is I'm convinced that we did not get a lion's share of these loans for a range of reasons that frustrate me. I'm not sure if it's even helpful to.
Well, I think. Well, here's the deal. Here's what. First of all, look, like my brother, he works with the Houston Restaurant Association, the Texas Restaurant Association. He was sending me text messages because he was hearing from a number of their clients, and there were a number of people who did apply. I remember reading a story, and there was a guy, and I think it was out of Wisconsin, and he was on the phone line, trying to get information. And I think the story said that there were 17,500 people who were ahead of him. Here's what I think the folks in Congress should have learned from this. It's a whole lot of damn small businesses in the United States.
30 million.
And
a third of them are minority small businesses. Go ahead.
And I think what they also should have learned is that, look, you can't be talking about open back up, get back going, this whole deal like that, and not realizing that those small businesses, they are the economic engine of this country. And I think what happens a lot, John, is that when we talk about business in America, it's sort of like when we talk about mega churches, people love to go, oh, the mega churches, they cause all the problems, when mega churches represent only 4% of all churches in America. Because we think big means everybody works there, when in fact, that's just really not it. It's the aggregate of the small businesses that you got to pay attention to.
Yeah. And we now know that 40% of people who work on hourly wage, who look like us mostly, are now the secondary responders who are allowing for everybody else to stay at home. They're delivering packages. They are stocking shelves. They are working in hospitals. They are the backbone of this nation right now. And they look like us, and they're at a higher risk of infections because they're not socially distancing at home or at work. But that's another topic. Back to your topic. I think that there's going to be a lot more respect, regard, and I'm going to go on the limb here and say resources that are going to be coming the way of Black and Brown-owned businesses in coming weeks, months, and I'm going to argue years. I think COVID-19 has changed America, Roland. It may be the most transformational event, certainly since the Civil Rights Movement, for sure, or the Great Depression. I'm sorry. I'm going to go on Great Depression economically. It might be the most defining event since the Civil War. Never has the world ever seen, forget America, never has the world ever seen this kind of a stimulus package. The Great Recession of the mortgage crisis was a $187 billion bailout. People lost their mind over that amount of money. This is $2.5 trillion in one package, $1 trillion that went through the Fed window, and another $1 trillion that went through various orifices. I mean, it's $4.5 trillion. It's 40 times larger than anything the world's ever seen before, because we're the largest economy in the world, and it ain't over. There's going to be a need for another $1 trillion, in my opinion, and I believe that there'll be another shot for businesses to get access to this capital. I think you need at least $500 billion, maybe more like $800 billion to plug this hole. It's coming, Roland, because there's one thing's not going to happen is the government's not going to let America run out of money. America's not going to let American business fail. And it's not black folks get the benefit because we're going to connect with all other businesses. If this is a black crisis, it'd be a problem. If this is a low wage crisis, this would be a problem. The fact is, this is everybody's crisis, and so it's going to get fixed.
So what is your advice? What is your advice to lawmakers to ensure those who absolutely need are not, frankly, at the back of the line, at the front of the line? When you talk about scripture, when you say, frankly, the last will be first and the first will be last. Unfortunately, when you talk about money in America, the first is first, second, and third.
Agreed. And by the way, showing about this is class and not race, Roland, I got money. I intentionally did not have my for-profit apply because I was involved in some of the structural stuff, so I didn't want anybody to say I benefited. So my for-profit didn't apply. My nonprofit applied, My nonprofit got approved instantly because we had the back end finance department, accounting department, our records were straight, and we were able to rifle shoot just like everybody else, our records in, and get in line and bug everybody to death until it got done. But I have a whole division that does that. I have 10 friends who've called me, black and white, all educated, have accounting departments, all of them frustrated, all of them got their money. It was a crap show. They were frustrated. They had to call 8 times. They all got their money. A lot of folks that you and I care about did not get their money, in part because maybe they didn't try, they went late, they went last, the records weren't straight, whatever. You're gonna get another shot at that apple here soon. Here's what I say to lawmakers: 2 things. One, this could have been avoided if we had the National Urban League, Church of God in Christ, First AME Church. The AME Church, the National Baptist Convention, Operation Hope. I'm probably missing a couple of groups. Let's throw the NAACP in there, their offices. Deputize them as federal community trust officers. Federal community trust officers. And give them the right and the authority to take the folks in their pews and in their client stables, client account lists, and counsel them and coach them, because we already have trust, in the requirements for these loans, and gateway them right into a priority list, to your point, with predefined group of banks or fintech firms or other firms approved CDFIs who put us at, to you say, the front of the line. And I'm going to say the second thing is, there should be a bucketed amount of money that's set aside in the next tranche, call it, I'm going to pick a number, $50 million, that is prioritized for African-American small businesses. We're dying at the highest rate in this crisis, and my guess is we're getting the lowest level of access to capital. And so those 2 things, if you did those 2 things, I think you'd see a transformational ramping up of liquidity and access to capital for our people. Just do those things. Pay the nonprofit groups to be the distribution channel, right? Don't ask them to do it for free. Deputize them so they have the authority to do it. Give them the training they need so that we're not giving people bad information, and give them the on-ramp to a defined group of lenders that put us at the front of the line for the application. That can be done in this next tranche, and I'm talking to folks at the White House that are open to that idea. I'm not talking to legislators, but you can certainly do that. Our friends in Congress on both sides of the aisle. So I think that's possible. And
right.
I'm going to go one step further, Roland. I'm actually pushing for a new Marshall Plan. I think this is the time to shove everything that we thought was important down a chute called reboot. Okay, and I'm talking about internships for all, apprenticeships for all, as much education as you can shove down people's throat. Black folks will never get reparations. It's a hard fight. But this could be reparations. Education for everybody, K through college. As long as you get a job, or you do something gainful, or do something like productive at the end of that degree, you don't have to pay it back, just like the PPP loan. It's an investment in America. It's not a handout. You're investing in America's people to reinvest in our society. It's not a handout. So I've got some other access to capital, using venture capital, publicly funded venture capital, heavily incentivized private capital for this purpose as well, to back a whole network of local enterprises that can become employers in our neighborhood that aren't rap stars. We got to be experts in something other than the arts, entertainment, and professional sports. That's not enough bandwidth to employ 40 million black people. I just love it. It's fantastic. Chris Tucker and Tip and all my friends, I love they're doing it. Oprah, I love you. But they can't employ tens of thousands of people. We need to back businesses, and I think call centers in our... But, Roland, I think... So I've answered your question. I over-answered your question.
I got you.
But I also think there's an opportunity for black folks, if you can get beyond the surviving mentality and get to a thriving mentality and a winning mentality and stop being angry, because anger doesn't pay a bill, and think like you think, which is to respond, not react. We're going to get through this, because if God wanted to kill us, we'd be dead. This is a reset, not a reboot, societally. We'll get on the other side of this, even with all the pain. What are you going to do in 4 months? on the other side of this, 6 months, whatever the number is, it'll be this year. And what are you going to do? Because the world's going to be different. And opportunities, Roland, please, your people need to hear me, will be everywhere. While I'm sitting here, I just got an email from somebody trying to sell me something that I've always wanted at half price. If I wanted to buy this 2 months ago, it'd have been full value. They're now trying to give it away to me. There's going to be a discount on stocks, a discount on real estate. I'm going to tell you a real quick story. I was at Ambassador Young's house during the last crisis. And he sends his love to you, by the way, Roland. And his gardener, black guy, I said, man, how you doing in the subprime crisis? You a lot of pain? He owned a little business. And he said, no, I'm good. I was poor before this crisis. So he said, I'm broke before this crisis. I'll be broke after this crisis. It's my rich white friends that want to kill themselves because they lost all their money. And what he was saying was that there's been a recalibration, and the wealthy folks were brought down to his level. Well, shoot, he's used to hustle. So now he's got an opportunity because there was a bifurcation on class. They were getting opportunities he wasn't. Now he's like, look, we all can hustle together to get this new opportunity. That's what I want people thinking about.
Mm-hmm.
Don't just get stuck on the frustration, because there's going to be a lift back up here, and there'll be two economies. This one, the L, that leads to recession, and this one, the soft U, that leads to recovery. I want us riding on this railroad, not on the railroad. They're going to both happen at the same time.
I got my panelists. I'm going to each one of them for one question. I will start with Greg Carr.
I think you've answered everything that I would have asked. Roland, when you asked about what policymakers can do, I am concerned about one of the kind of soft underbellies in our community, particularly these very small businesses. You know, how can folks move very quickly to get, as you say, their paperwork in order so that they can go through that very clean chute? I'm sure people are scrambling now, Brother John.
Yeah, call me. This is what frustrates me. Like, I've been saying this to my people for Roland knows, 6 weeks now. Call Operation Hope. Services are free. We'll help walk you through this. We've gotten some calls, but when did my website crash? When Gayle King put me on CBS This Morning, mainstream audience, and made the same offer, my website crashed, my phones exploded, people saying, sign me up. I need folks who look like me to use our services. Call me, and I will, not me personally, but call Operation Hope. We will walk you through this process. I'm in 22 states. Services are free. So, yeah, I'm with you 100%. But there's a lot of historic reasons why we don't trust government. We don't trust banks. I get it. Freedmen's Bank, I get it. We got to get over all that stuff because the money will run out while we're sitting here contemplating.
Right.
It did run out, actually.
Reese.
So I've seen reports about how this administration has given out no bid contracts into one specific company, over $100 million contract for N95 masks, and it's bankrupt. There's a huge opportunity, as you said here, outside of even the loan aspect and the grants and stuff that were available in terms of government contracting. Are you involved, or do you know of any resources that can help minority Black-owned businesses, Black woman-owned businesses get in on this federal contracting, contracts that are being put out there? Because it does seem like we do get left behind, even though there's supposedly all these, these set-asides for us and all these quotas, which the administration is trying to do away with in the meantime. How can we be a part of that, or make sure that we're not left a part of that?
The lady's question is dead on right. And I'm not going to give you an answer you like. I think that all the structure and the programs and those are great and people mean well. But in a crisis like this, the urgent crowds out the important, and people rely on their relationships. So somebody in the government, not meaning to discriminate against you and me at all, trying to solve a problem, is going to reach out to whom? Their friends. Whoever called, somebody they know, somebody they've known for 10 years, went to school with, I don't know. But somebody who they hooked up with, or somebody knows somebody, hey, I can get you these masks. Oh, really? Tell me about that. That's who's going to get this deal. So you're right. And you will find out about this when the dust settles. I want you to be part of the dust settling. Okay? So you've got to get a hold of Nicole Frazier at the White House, who is special assistant to the president for African American Affairs. She's actually a nice person. You got to get a hold of Jerron Smith. Roland knows all these people. And in fact, Ron's going to come on Roland's show. He's actually a good brother. I found him to be an honest broker. We don't talk politics. We only talk about these issues. And he respects the fact that I don't want to talk politics about that situation. And he's an expert in Q-qualified opportunity zones. He's an expert in CRA, Community Investment Act, and he wants to get you opportunity. You got to get to know these people. You got to get to know Chris Pinkerton at the White House. You got to get to know people running the SBA, the people running these different agencies, because life's about relationships. And so, okay, you don't have time to get to know them right now? Fine. Send them a soft letter. Send them an email. Let them know who you are. Let them know you're not selling them something right now. Here's what your company does. Here's what you're offering. You'd like to have 10 minutes on the phone with them. Folks don't have time right now for an hour conversation. 5-10 minutes just to orient them to what you're doing so that when the opportunity comes around that you're available, and let them know you're a minority-owned business. Play that card. And copy me, copy Roland. When you send these notes, Roland will give you my information. Roland, you could probably get them on this next call with the White House for Black leadership. The first call we did was 4,000 people. They'd never done it in the history of the White House, of this White House. And they were nervous a few weeks ago when they did this, but it worked out really well. And no one got political on either side. And we dealt with the business. You need to be on that call or have somebody on that call that you deputize from your community who raises intelligently, thoughtfully, not emotionally, the issue you just raised, and let them respond to it. So I think that this is my suggestion, is you got to insert yourself in the process in a way in which that's effective, which means I want you to respond to issues, not react to them. If we react to this and get emotional, we're done. If we get angry, start cursing people out, and nobody got time for that right now. Nobody cares, actually. You've got to insert yourself into the flow of literally billions and arguably hundreds of billions of dollars in the next 90 to 120 days. It'll probably last all of this year, but most of this money will flow in the next 4 months. Roland, you agree or disagree?
No, I agree. Absolutely. I think especially I've been telling people, prepare yourself mentally that we're going to be dealing with this to the end of the year. It's not going to just go away in 60 or 90 days, even though some people want to wish it to go away. Brooke Thomas, final question from you for John Hope.
And by the way, go to your member of Congress, get them to write you a letter as well. Congress has a lot of sway right now. Sorry about that, Roland.
Go ahead, Brooke.
Yeah, I just have a question. It may be a little bit of a reiteration, but I'm curious as to what is the concern or question that you're getting the most. You mentioned your website crashing after the CTM appearance. What is something that is representing itself as like the biggest concern, or something that you're getting so often? Because often other people have that same question or concern.
Yeah, great question. So just so happens I have the results here of my call center, of the call-in. So this was before Gayle King's show. This is our people in 1 month. Typically what would happen is people would call in, they had one request. I want to be part of your 700 credit score program, get my credit score up. I want to become your home program. I want to be part of your small business program. It wasn't 2 or 3 services, they just went one. Here's what we got. So think about 100, a ranking of 100 now. You'll think my math is screwy, but what this means is that the same person was asking for 5 things. Okay. 59% wanted assistance with the SBA process. They were confused. 47% wanted assistance with federal programs, like the accelerated unemployment insurance, like the earned income tax credit, which you can still get, and you need to apply for today as another $3,000 to $10,000 in your pocket that, again, we don't apply for. Go get your money. It's nothing to do with COVID. Go get your $3,000 to $10,000. Like the check that should be hitting your mailbox this week or next, and I can tell you about that, pretty much tell you how much money you get. But even if you didn't file a tax return, you get that money. But you've got to go into the IRS website and let them know where to send your money. Otherwise, you won't get it. So 47% of that. 33% wanted help restructuring a home mortgage. 33% wanted help with financial recovery planning. This is really smart. 38% wanted help with negotiating with their creditors. And 23% wanted help with student loan deferrals. And then 26% wanted help with credit counseling. So the lowest number here, it was my highest number a month ago. Credit counseling, credit score assistance, that was my highest ask. It was singular. Now I've got 1, 2, 3, 4, 5, 6, 7 asks, by the same person who had members of their family with multiple needs. Mainstream America, Gayle King's show, they wanted help with the federal loan program and mostly restructuring their finances. So the problem has now become mainstream. I'm predicting that what I was doing for Minority America now is going to apply to 80% of America in the next 2 to 3 months.
John Hope Bryant, always a pleasure. Tell folks where the website, where they can get more information to log on right now.
Yeah, operationhope.org, Hope Inside Disaster, COVID-19.org. All services are free, or you can call 888. I forgot my toll-free number.
Take your time. Take your time to find it.
It's on my. Well, okay, I'll find it for you. It is 888-388-HOPE. 888-388-HOPE, and we have an app coming out next week that'll be on the on all your platforms. That's called Hope in Hand, Hope Mobile. You'll be able to do all this stuff right from your app as of next week. Go get your money that's still there on the individual assistance program. Make sure the IRS knows where to give you your money. If you're a senior citizen, you still get the money. If you're a documented alien, you get the money. There's a lot of categories, and if you have children, you get another check. If you have a spouse working in the house, you get another check. Make sure they give you all of your money from that program, and go get your EITC, Earned Income Tax Credit. Anybody making less than $54,000 a year, most of us, that's another check, and it's 3 years retroactive.
And that's why Roland Martin Unfiltered matters, giving you this information directly, because frankly, it's not. John don't get this much time on the major networks. But that's why we got to walk ourselves through information is indeed power. John Hope Bryant, we appreciate it, man. Thanks a lot.
Love you, man. Life.
I appreciate it, sir. Thank you so very much. Man, I want you to like, share, and subscribe to our YouTube channel, youtube.com/Roland S. Martin. And don't forget to turn on your notifications.